this meeting to order. Thank you very much for joining us this morning to our City Council special meeting here. Ruth, could you please call the roll?
Yes, sir. Adamson?
Here.
Bray?
Here.
Cheatham?
Here.
Lurick? Here. Ortega?
Here.
Stevens?
Here.
Platt?
Here. Thank you. We'll go ahead and Pocatello City Council will receive information from local health care experts to help them develop an emergency health plan for the city. First of all, before we really jump into the middle of anything, I would like to thank everybody for rearranging your schedule. I recognize that everybody, for sure in the healthcare professions, we have Mayor England back here, and the school district, Superintendent Doug, and for rearranging your schedule on such a short notice. Thank you very much for doing that. We sometimes forget how busy everybody is, and we've got to get something done, and so obviously this is important for everybody to be here, so thank you very much for being here with us. With that, I would like to just go around the room. Probably, let me see, we've got mostly staff. Doug, how are you?
Fine, thanks.
So we have the school. Why don't we start here? We've got a couple to introduce themselves, Mayor England, and then let's just introduce ourselves so we know who everybody is in the room before we really get going anywhere. So,
I'm Dave Matson. I'm the chair of the school board.
Courtney Fisher on communications for school district 25.
Steve Anderson, interested citizen. Kevin England, man, Charlotte.
we're good.
Pete Gates.
Fire Chief.
Levi Adams, the wastewater superintendent.
Jared Johnson, city attorney for the city of Pocatello.
Jeff Mansell, Public Works Director for City of Pocatello.
We've got Ruth, our city clerk, that's going to be taking notes and writing things on the whiteboard, maybe.
And I'm Rex Morse, Vice President for Health Sciences at ISU.
Doug Howell, Superintendent of Pocatello School District.
Scott Krause with County School. Jacob De La Rosa, cardiac surgeon, Portland, Minnesota.
Kathy Olson. Oh, excuse me. I'm Kathy Olson. I can hardly hear anybody with the mask, so I'm please asking you if you'd all speak up a little bit. I'm a nurse and a retired ISU nursing faculty member.
Jonathan Cree, I'm the chair of the Department of Family Medicine at ISU, family physician.
Sean?
Yes, yeah, so I'm Sean Majock. I'm the CEO of the Portland Health Trust.
Luis Fernandez, Portland Medical Center, also medical director of the health department.
Mark Gregson, the interim CEO at Portland Medical Center.
Tom Kirkman, Deputy Public Works Director, City of Pocatello.
Jim McCoy, Deputy Chief Pocatello Police Department.
Mark, I would like to thank you. He found out about this meeting late yesterday afternoon, so thank you for changing your schedule to be here with us today. We have...
We don't get to introduce ourselves.
I'm sorry. Yes, please.
Dr. Ron Solbrick, been here 27 years, done about every job that's possible for a family physician to do in the city of Pocatello. Currently still the director of Student Health Center at ISU and working with the coronavirus team at Iowa State University. And work very closely with the health department in mitigation strategy.
I'm Maggie Mann. I'm the district director for Southeastern Idaho Public Health.
Thank you. I apologize for I just assume everybody around the table we know, so thank you. We do have possibly joining us on our GoToMeetings platform. If he calls in, will be Dr. Newhouse, Dr. Ken Newhouse, if he's able to call in. He's on vacation visiting family and said that he would call in, so hopefully he's got the links and he can get in, hopefully. So.
Hey, Mayor, this is Dr. Newhouse coming to you live from the cheese curd capital of the world, Wisconsin, USA.
Dr. Newhouse, I've been lying to everybody. I told them you weren't in Wisconsin. You were in Minnesota or something like
I think I'm the one who said Minnesota.
Well, there's a small river that's separating me from Minnesota, which is, we're on exit 1 in Wisconsin, so, let's not quibble about 4 miles.
Well, good. I hope you have some good brats for us while you're there.
Will do.
Sounds great. Then what we'll do is go ahead and I've asked Stephen Weig if he would moderate this for us and do some things. So I'm going to turn a little bit of time over to Stephen, and then we'll go from there.
Thank you, Mayor. Welcome, everybody. And I'll try to project enough that you can hear me. If you can't hear me, Kathy, just give me a sign. My understanding from the council last week was you wanted to hear from health experts and try to find out what to do and how the city might proceed. And so I've tried to structure a number of physicians and other people have been invited. I thought I would start with Maggie Mann from the health department talking about what they've been doing. They have a lead role in terms of looking at public health, and then have comments from the medical community. I need to double check if anyone has a time constraint. I talked to Dr. De La Rosa. He's looking about 30 or 40 minutes. About 30 or 40 minutes. Are there any other physicians or anyone, Dr. Newhouse? Are the brats going to call you in Wisconsin, or any other time constraints that people have? Dr. Fernandez?
Yeah, I have to be back at the clinic. So 9:40, I need to leave.
Okay.
So,
Dr. Newhouse?
I'm good.
Okay.
So Stephen, I apologize. I meant to mention also, I know Maggie has an appointment that she's got to be to, and so she's going to have to leave around 11-ish. She told me last night, so.
Okay, so let me just do a little rearranging then. Maybe since Dr. Fernandez and Dr. De La Rosa have to leave fairly quickly, maybe what I could do is give you two gentlemen a chance to make a comment first, a couple of minutes, and then we'll go to Maggie and talk about what the health department is doing, which may take a little time, which may take 30 minutes or so we'll do that. So Ron, if you could vacate that chair, and either Dr. Fernandez or Dr. De La Rosa, if you want to come first.
Mr. Moderator?
Councilwoman, yes.
I understand we're here to receive information, and I'm really grateful to everyone who showed up. I'm wondering if we have any other action goals and objectives other than simply listen today, or just so we all are on the same page about why we're here and what we hope to achieve.
My sense is by the end of the meeting, the city, you all together will decide on what your path forward is going to be.
Okay, thank you.
So it's not just hearing, but what then will the city do? What course will you take? And we'll talk a little bit more detail about that after the presentations. But really, I think it's not just to listen, but really what role will the city of Pocatello play as we try to deal with this issue in front of us?
Okay, council, are we in agreement that that's? That was my understanding.
That's what the motion was, and so that's why we're here.
Great,
Okay.
Thank you, appreciate it.
I think was fairly clear from the get-go last week that we would be able to do that. So,
all right, Dr. De La Rosa.
Thank you. My name is Jacob De La Rosa. I'm the Chief of Cardiac Surgery at Portland Medical Center. I've been in Pocatello for almost 17 years, functioning as the Chief of Cardiac Surgery, as well as starting the program here 17 years ago. I want to thank the mayor for inviting me to come to this very, very important meeting, as this sets the course for our city. I first want to read a letter that was provided to me. Our Chief Medical Officer is not available. He is out of town, and so he submitted a letter on July 8th to the mayor and to the city council, and I will just read it. Thank you for your service and leadership during the COVID pandemic. I have reviewed the proposed ordinance regarding face coverings. In light of the vote tomorrow, as Chief Medical Officer at Portland Medical Center, I offer my full support in favor of mandatory face coverings as outlined. The data certainly supports face coverings, and it is an effective means to slow the spread of coronavirus, thus protecting our community and healthcare resources. The proposal is well thought out and is very reasonable approach to universal masking. I appreciate your consideration. Please reach out to me if you have any service. That is from Dan Snell, the Chief Medical Officer. So I just wanted to make just a real brief comment, and I wrote this down for us to discuss. As COVID-19 cases continue to soar across the United States, as well as Bannock County, as we will hear, the debate surrounding the mandatory mask policies is as heated as ever. Do they truly work? Or as some critics argue, is it truly much ado about nothing? According to the new findings published yesterday in the Journal of American Medical Association, that is JAMA, that is one of the leading journals that we have in the United States and in the world, such policies appear to work quite well. The study's authors found that enforcing strict masking policies is directly associated with lower COVID-19 rates among healthcare workers. The researchers tracked infection rates across Boston, Massachusetts, and found a significant decrease. So I just leave you with all of that. I will tell you from our own experience here at the hospital that we, and from the cardiovascular, we saw very low rates early on in March. We didn't see that. That's not the way that it is today, and it's not what is going on right now. So I think it's very important to consider this in a whole gamut of mask wearing, hand hygiene, as well as social distancing in the decision you all make. Thank you. Take any questions?
Sure, I think before you leave, if there's folks that have a question or two, Councilwoman Lurie.
Yes, and I'll probably ask this of everybody who gets up here, but a lot of what we're hearing from the public is, and you kind of hit on this, but that masks actually make you sick, that they're more harmful than good. So, you know, I've heard the studies about, and trust the studies about the good that they do and the preventative that they are, but can you just address that concern about that they're harmful to you in some way, that you're breathing in, like your CO2 levels go up too much, or you're breathing in toxins, or it's hurting your immune system, or as a doctor, can you speak to
Sure. I will comment that I've been wearing a mask for about 25 years, every day, and for 8 hours at a time during operation. And I think my lungs are pretty good, and there's been no problem. I think that's definitely a concern with a lot of people, especially with asthma, et cetera. And that sometimes is difficult. And there's people that we should reserve places who should not wear a mask, who that medically indicated should not. But I think for the most part, masks have been safe to wear. Hope that answers your question.
Thank you. Yeah.
Yes.
Dr. De La Rosa, so aside from asthmatics, what other group would you say should
I think people who feel restricted, meaning that there's a lot of people that feel that, you know, even standing next to somebody normally is too much. And I think, again, just having a face mask, as we all have face masks, we all know what it feels like to feel restricted. And some people, that's a significant problem for.
Okay.
I think that's the other people that I would say also should be kind of leaned away from being mandatory mask wearing.
Gotcha. Thank you.
Other questions from the council? Thank you.
Thank you all.
Appreciate your time.
Thank you, Doctor.
Thanks.
Dr. Rodriguez. Fernandez. Sorry about that.
Morning. Thanks for inviting me to be here. And my email went to spam, so that's why I couldn't see the email. But I don't have too much to comment other than supporting what Dr. De La Rosa was saying about supporting the wearing mask in public places. I think there's enough evidence. I agree with that. That supports the use of it to decrease the spreading of the disease. I think in some places like in Florida where it became a political problem, we see a surge of cases and increased death too. So I'm thoroughly supporting that. We also have to remember that Idaho is still in the red zone from what I got from the state. And even when the counties that are more, we have more cases are not necessarily Pocatello, we are part of the state, and I think we see an increase of cases and the number of cases, and I don't think it has to do with the more testing. I think it's the fact that the coronavirus is spreading across the state. And one other thing that worries me is how we are going to open the schools. As we know, children are hard to control in that environment. It has to be a a well-planned situation. And I'm really worried about that because I have a child that is, in the school system that can bring the disease home, where we have also elders in the house. So that applies to almost every household in Pocatello. And that's all I want to say for now.
Any questions for, I think we need to maybe ask you a question about what is the purpose of wearing masks? Because we're hearing that people say, I don't catch it and I'm not wearing a mask. What I've read is that the purpose is to wear a mask in case you have it, to not spread it primarily.
Yeah.
Could you explain that?
Yeah, definitely. I think the masks have been proved to decrease the spread of the droplets that come out of your mouth when you talk, when you sneeze, when you and then the purpose of it is actually protection of other people, but also yourself. I had a patient yesterday that had a problem wearing a mask, but she had she has a lot of anxiety regarding it, and I was like, it's probably better if you have, because I'm trying to protect you too. If I have seen patients with possible COVID-19, and I don't know if I do have that covered right now. So I think I'm protecting. So it's basically to protect other people and decrease the spread in the community. I think it's very rare that people have conditions for what they cannot wear a mask. I mean, most people wear masks when they ski, and they don't have a problem with that when it's cold. You see people that go, scuba diving and different other things that might be even worse than wearing a mask to decrease the spread of the disease. So I think there's a lot of politicization of that, and also misinformation. I think the mask is definitely proved to decrease the spread of the problem, and that's the only weapon we have now is social distancing and the mask. Nothing else.
So you use the word weapon. If we're at war, a mask is a weapon against the coronavirus.
I think it is a protection that everybody should have. It's the only thing we have.
Dr. Fernandez? So just to clarify for the people watching and listening, the mask doesn't prevent the coronavirus. It doesn't. All it does is slow the transmission and minimize the amount of contamination from one person to another. And the studies that I've been reading lately show that in itself reduces the severity of the disease when someone does get it. Am I correct? So if there's smaller amounts of transmission, then those people who are exposed don't get the disease as badly. Did I misread that?
I cannot say that that's accurate.
Okay.
Once you have the virus and reproduce in your body, I think that makes sense that it can be very severe or not. Some patients respond very well to it. Other patients have really critical, develop really critical conditions from the virus. So I don't think when you get the virus, I don't think that the mask is, it's important anymore.
Okay.
I think doesn't matter the severity at that point.
So my understanding would be that the mask slows the rate of transmission, but if you get it, all bets are off. Is that correct?
But if you've got it and you wear it, you slow the rate of transmission to someone else.
Right, definitely. But I don't think it changes the severity of how you can respond to the virus. That's independent.
Yeah, once you got it, it's like a cold.
Exactly.
It's going to ravage you based on who you are and what it does.
Right.
Any other questions? Thank you very much. I appreciate it. Appreciate your time. Okay. Ms. Mann, would you like to, are there any other physicians that have a short time frame that need to speak before we can move on? Hearing none, I've asked Maggie Mann, the director of the Southeast Idaho Public Health Department, to talk about what they are doing and the approaches they're taking. They have worked with the school district on its plan. My 2 cents worth at this point is that I think it's extremely critical that the major players in our community are aligned. If we're talking about green, yellow, red, it would be very difficult for me as a citizen to go, well, gee, the school district said yellow and the health department said red and the city's at green. And ISU is purple, and I don't know what. And I don't know what.
Wait a minute,
Orange, go orange.
Go orange.
We need orange. ISU, we do not like purple.
That's
Weaver State color, no way.
Anyway, so I think consistency across our organizations, our leading organizations in this community is really essential. So, Maggie, would you like to present?
Sure. So I want to thank Mayor Blad and the City Council for hosting this meeting today. I thought that I would give you just a little bit of background on the response to date and then what our plans are for moving forward. And I'm happy to answer questions as we go through this. I do have some handouts, and so I'll pass them out as we go through. I made 20 copies of some and fewer of some of the documents that maybe are a little bit more technical and maybe less interesting to some of you. But so at the Public Health District, the first call that I got on related to COVID-19 was actually on about the 6th of January. The CDC convened a national level call for public health officials around the country to just give us sort of a situational awareness about this new virus that had been discovered in the Wuhan province of China. And so we continued to be on those calls every week through January, and then towards the end of January, we started convening what we call our internal response team. So anytime we have a situation that looks like we might have to mount some type of response to it, that is the initial group that starts building that response. So we continued to meet through February. Then in early March, Portneuf Medical Center hosted a community-wide meeting, and at that meeting, several community leaders, including Chief Gates, made a decision that we needed to establish what's called a unified command. And I don't know how familiar you are with incident command structures. I'm sure law enforcement in the room are familiar with that concept and that practice. But we were at Portneuf Medical Center over the lunch hour, and by 3 o'clock we had stood up this unified command. We did a media conference. I believe Mayor Blad was there. The Bannock County Commissioners were there. So Unified Command brings together a wide variety of community partners to bring resources to bear on a given situation. It's a concept that was initially originated in wildland firefighting. And so we included and we cover an 8-county region in southeastern Idaho, just so you know. So Bannock County is our most populous county. We stretch up to Butte County, Bingham County, Power County, and then our southern counties include Caribou, Franklin, Bear Lake, and Oneida. So we involved each of our 8 counties, all of our hospitals, healthcare providers, school districts, chambers of commerce, fire and EMS, law enforcement, coroners and mortuaries, and the United Way. I'm sure I'm forgetting partners, and I don't want to slight anybody, but it gives you an idea of the scope, and of course the critical one is ISU. So that gives you some idea of the scope of the partners involved. We started meeting on a daily basis, and we met every day for probably 6 weeks, and then we dropped down to a couple times a week, and now we're meeting once a week. Because we went through that storming, norming, performing phase. And I want to give acknowledgement to Chief Gates. He was absolutely critical in standing this up and getting it operational and helping it to move forward. And we really appreciate that. So out of Unified Command, and I'm going to share a couple of documents with you. So on a weekly basis, we publish what's called a coordinated action plan, and that goes out to an email list of over 100 community partners. I only printed 5 copies of this because it's pretty dense and pretty technical, but I will circulate that, and if you're interested We also publish every week what's called our SITREP, or situational report, and it provides information on what our areas of focus are for the coming week related to our response. It provides data, actions to date, some contact information, that kind of thing. So I have more copies of this because it's a little bit lighter read and maybe more interesting.
So Ms. Mann, just for clarification, these documents come from this unified command process, not just from the health department?
Yes, that's correct.
Can I make a copy of yours later?
So in that unified command structure, we have different groups that tackle different focus areas based on their expertise. So we have a school-based group, a healthcare group. Dr. Newhouse has been very involved with our healthcare group. Dr. Solbrig and Dr. Cree have been very involved in looking at testing availability and testing options and what are legitimate testing options. They've also been very involved in ISU response along with Dr. Force and a wide variety of other people, looking at how do we come back to campus in a safe way? How do we ensure that campus housing is safe? How do we ensure that classrooms are safe? How do we ensure that athletic events or community theater or all those things that ISU is so well known for are done as safely as possible? And I have to say they've done an outstanding job, as has School District 25, in planning for, which they've been doing now since the soft closure began, planning for how do we go back to school safely. And I so appreciate Superintendent Howell and Courtney. Courtney and I talk on a regular basis, and I think where their plan is at is in a really good place. So that's kind of a 30,000-foot view of activity to date. And so I want to talk about our current situation and then moving forward. So I have a couple of items here. This one is just a snip of the front of our coronavirus webpage on the SIP website. And so it shows our data. It talks about today's cases, confirmed cases, probable cases. Probable cases are people who are close contacts of a confirmed case who have symptoms but for whom we don't have a positive test result yet. It also looks at the number monitored or what we consider active cases that we're currently doing contact tracing for. Currently hospitalized, total hospitalizations, and deaths. And I will say that we have more people currently hospitalized than we have to date. When we look at our numbers, they are small when you compare them to a place like Arizona or Florida or even Boise. But our concern is that we know that this situation can change very rapidly. We have seen that happen. And I was listening into the governor's coronavirus task group meeting on Monday, and the leaders of the three biggest health systems in the Ada and Canyon County areas were sharing that they feel like they are at a critical point, that they are very close to being overwhelmed in their hospital setting. And one reason that is so important is we're not just concerned about the people who have COVID. We are concerned about people who need cardiac care and emergency surgery and to deliver babies and have broken bone sets. The whole system and ability to deliver care has the potential to be impacted if our numbers get out of control. I want to emphasize, I don't think we're there yet, but we have seen that this can happen very rapidly. So I will go ahead and pass this around. The other thing that I want to emphasize, just the nature of communicable disease. This is a new virus. We really have only known about this virus for about 7 months now. And our information base as a result is changing every day. If you had asked me at the end of March if I supported universal mask use, I would have said no, because I had not seen any evidence at that point that these were effective in helping to limit the spread of the virus. My perception has changed and my understanding has changed since then. Because we have more information about the virus, we have more information about the efficacy of mask use. And I fully support these now. And my concern is not only the school, K through 12 schools going back and ISU going back, but also keeping our economy open. And I believe that this is a pretty simple step to be able to take to protect other people, but also to keep our economy going. So the next two things that I will share, it brings us kind of to date. So we've been working with our peer district that's based out of Idaho Falls. They're called Eastern Idaho Public Health, and they cover an 8-county area just to our north. Their population center is Idaho Falls. So we worked together to draft this document. As the governor announced a couple of weeks ago, he is in the process of transitioning decision-making to a regional level. And he's relying on local elected officials and public health districts to work in cooperation to make decisions about what kinds of strategies need to be in place. And so my peer in District 7 and I talked about the need to be aligned between our two districts because there is so much back and forth between our area and their area, either for work or recreation or family. So her board voted to adopt this plan specific to their communities on Tuesday. My board is in the process of reviewing this plan, and so I want to distribute this because I think it may answer some of your questions. It's important for us to make decisions based on data. And so we needed to narrow down what are the metrics that we're going to be looking at to make decisions about do we need to put different strategies into place, okay? So I want to emphasize a couple of things. One is that this is a draft and it says it all over it, so it's pretty easy to see. But it's also a fluid document. As we learn more about this situation, there's the potential that these metrics and the strategies connected to them may change. I also want to emphasize that sometimes the data are a little behind reality, and we are in close communication with our hospitals and healthcare providers throughout the region, having conversations about what does your situation look like? What does your PPE supply look like? And PPE is personal protective equipment for anyone who isn't familiar with that acronym. What does your healthcare staffing look like? What does your bed availability look like? What does your ICU bed availability look like? What does your ventilator bed capacity look like? Because sometimes the data are a little bit behind what the current picture really is. So I want to walk you through this. Right now,
in terms of your data, my understanding is things have changed in terms of CDC and availability of data. Is that going to affect you?
So that's more a reporting mechanism upwards. So we are relying, our data, for example, from this comes from the confirmed cases that come to us. Okay. Then we report up to the state, and the state reports up to the federal level, okay? So there has been a change in how data are being reported to the federal level instead of going directly to the Centers for Disease Control, as they always have been for all communicable disease reporting. They are now being required to go to the Department of Health and Human Services directly. So I think that's the change.
I just didn't know where it broke down.
Yeah. So we'll just walk through this. So currently and I want to emphasize, and it states it in this plan, the strategies and metrics in this plan may be implemented in a variety of ways. They could be implemented at a city level. They could be implemented at a county level. They could be implemented at a broader geographic level or across our County continues to not have a case. They're one of 3 counties in the state of Idaho that has not had an identified case yet. So we would not put the same strategies in place in Butte County that we might in Bannock County or Bingham or Franklin, where we're seeing more cases. Okay, so right now we're in the green section. I think that when we got to stage 4 of Governor Little's guidance, many people saw that as, okay, we're through this and we're done because everything's opened up now and we don't have to worry about this. And that's an unfortunate interpretation of the situation, because as things open up, strategies like physical distancing and mask use and regular hand washing, covering your cough and sneeze, those become even more important because we're interacting more with each other. And so instead of seeing less mask use or less physical distancing, we would hope that we would see more, because that's really what is needed in order to keep our economy open and going and thriving. So it talks about that in here, and then we move into moderate risk. So the thing that we're looking at is a rate of active cases of greater than 10 per 10,000 sustained over 3 days. So a couple of things about that. Active cases are the ones that we are currently monitoring. So if you've been released from monitoring because your symptoms have been resolved for the appropriate amount of time, you're not counted in that active case count. We picked a 3-day sustained period because 1 day could be an outlier, and we don't want to knee-jerk react to something if it's just sort of an aberration. A week is really too long if we're going to stay up on contact tracing and implement it the way it's intended in order to limit further spread of the virus. So we settled on a 3-day sustained period. And then these are the numbers of active cases in each county that we would need to reach that rate of 10 per 10,000. Also, most rates are expressed per 100,000 in public health, and we made the decision to drop that down to 10,000 because many of our communities are very small, and it's really hard to wrap your head around a population, a rate per 100,000 people. So we dropped that to 10,000 because we felt like it was easier for people to make relevant. Yes?
I don't mean to interrupt, I just want to make sure I'm following. So these numbers would be under the monitored column on this sheet, correct?
Correct.
Thank you.
Yeah. And we will probably, once this is approved, if it's approved as it's written, we will probably change or add the word active, like monitored/active, so that it makes it easier for people to understand that. So you can see for Bannock County, we would need to be working with 88 people or active cases each day over 3 days in order for us to consider moving to this column and considering some or all of these strategies, okay? These are listed here as sort of a menu approach. It doesn't mean that we would do all of them. The other thing, and this is not the only metric that we would look at. So we also want to look at our ICU bed capacity. And if it has reached 90% or greater at least 2 to 3 times during that week, that same week that we're seeing those 3 days sustained, okay? So any questions about, yes?
But that's not ICU beds occupied by COVID patients, that's just ICU beds.
Correct.
That's all kinds of diseases and issues.
That's correct, because they all matter. They all need those beds. So we didn't want to only be talking about COVID-19.
Yeah, I just wanted to clarify that for the people listening.
Thank you.
Meg, let me ask a question on authority. So if your district adopts this plan and we got into the yellow category, then if your district then chooses 3 or 4 of these elements, say we need to do this, then everyone in your district has to comply with that order?
Everyone in the area for which we say
The area
this
for
needs
which
to
you
happen.
select. So an area can't say, and if you said that Pocatello, you're in it, you all need to do A, B, and C. Pocatello would have to comply with A, B, and C. It couldn't choose to ignore your direction.
So the
I'm just
Idaho
thinking about who's got the authority to do
Yeah,
what.
so let me give you a little bit of statutory background, and I probably should have shared that right up front, so I apologize. So the public health districts were created in the early 1970s by the state legislature to ensure the provision of local public health services in the entire state, regardless of population size. And in our public health districting law, which is 39, Idaho Code 39, Chapter 4, in 414, it has a pretty broad statement, which is that the Board of Health has the power and authority to do, quote unquote, all things for the preservation and protection of the public's health. It's a fairly broad authority. It, quite frankly, has never been tested before on this scale. So it's something that we're all looking at and trying to assess how do we do that. But the legal interpretations that we have received is yes, we would be able to take these actions and make them mandatory should we get to that stage based on that public health districting law. 39.415 also is specific to quarantine, and we have used that piece of the law in the past for things like active tuberculosis cases. We always try to work with people on a voluntary basis. We do not ever come in and, try to be a heavy hand. We try very hard to work with people, and most people are cooperative. In the almost 25 years that I've worked in local public health here in southeastern Idaho, I think that we have only issued mandatory isolation or quarantine orders for active TB patients probably 4 times. And they were, in each case, it was someone who was just refusing to cooperate no matter what we tried for that person. And so we did issue those orders.
How did you enforce it, Maggie?
So we work with local law enforcement to enforce that. And we've had a couple situations here in Bannock County and the city of Pocatello. We've had a couple in Bingham County. And so we work with local law enforcement. They typically accompany us to deliver the order to the individual if it reaches that point. And then they've gone so far as to station an officer outside the person's house to ensure that they don't leave. That is rare. I think that's only happened 1 time. Usually when we take the step of issuing that order, people realize it's pretty serious, and then they start to work with us. We have never jailed someone. We have never charged anyone with a misdemeanor. It's just it's a tool of last resort to get people to work with us. Okay. So, and any of these actions would require approval of our Board of Health. Okay. Our Board of Health is because we have 8 counties, has 8 members, 1 from each county. Most of them are county commissioners who are sitting county commissioners. We do have 2 members, 1 from Power County and 1 from Butte County, who are not current county commissioners, but who have been on our board for years and have a good understanding of the county process and public health. So the next stage, which we call high risk, again looks at rate of active cases, but it doubles. So if we have greater than 20 active cases per 10,000 population sustained over 3 days, then we would consider taking some of these actions over here in the right-hand column. We would also consider outbreaks or clusters of COVID that are occurring either in hospitals, healthcare providers, or EMS. Critical infrastructure like fire, law enforcement, utilities, congregate living centers like skilled nursing facilities, jails, aid for friends, those kinds of settings, schools or institutions of higher learning, and then then mass gatherings. In our district, family gatherings have been a pretty significant contributor to spread. We've had any number of them that have done that. And then this one, the number 3 sounds initially similar to number 2 in the moderate risk level, but we're actually looking at total bed capacity in this scenario rather than just ICU bed capacity.
And Maggie?
Yes.
I just want to point out the word "or" in between those sections, because it's not that all of these things have to occur. It's any set of these scenarios before you would transition to picking from the menu on the right.
Correct. And that's when our conversations with our hospitals become very critical, because if we have 176 active cases, but we don't have anybody in the hospital due to COVID and our hospitals are doing okay, then we're less likely to take one of these actions. But if we have that number of cases and our hospitals are telling us, hey, we're not in good shape, then we're going to pay attention to that. Then the last stage is our critical risk, and that's when, and we hope we never get here the way some states have, when our hospital capacity is beyond 100% and that they're having to resort to what are called crisis standards of care. And there's a definition of crisis standards of care here, and the state of Idaho has adopted those just in the last 2 months. And essentially it means, how are we going to ration healthcare in an ethical way? What are the decision-making points for us to make decisions about who gets healthcare and who doesn't? And that's something that we're not used to in this country, and we don't want to go there. So that's our draft plan, and I'm happy to answer any additional questions about it.
So if I were to do a generalization from this, each stage, the suggestions or requirements are there to stave off moving to the next level.
Yes.
So at minimal risk, there are certain things you need to do because we are facing this to prevent us from going to the next level.
Correct.
And if we get to the next level, okay, so.
That's why it's so very important, even though many people will say, I don't even know anybody who's had this. You know, we've been very fortunate in southeastern Idaho. Idaho, in general, was one of the last 4 states in the country to have a confirmed case in March. Southeastern Idaho was the second to last public health district in the state of Idaho to have a confirmed case. And we continue to have counties, or a county that doesn't have a case. Even Bear Lake and Oneida counties just had their first cases within the last week to 10 days. So we have done really well, and that's sort of a blessing and a curse. We are so grateful and thankful that we have not seen the outcomes that some places in our country and the world have seen. But at the same time, it's created sort of a complacency and apathy, and we're tired of this, and I get it. I'm tired of it. My family is tired of it. My friends are tired of it. My colleagues and our community partners are tired of it. Everyone is. But we don't want to let that weariness of the situation result in outcomes that end up being even worse. And I recognize that I have spent my entire career working in a prevention-oriented field. Not everyone has. And I understand that, but there are just some very simple steps that we may choose to take that will help protect us and our families, our neighbors, our colleagues, and this community. And from my perspective, they are simple steps. And this is a wonderful community, and most people, I think, have done an amazing job.
I have one question to follow up. When you cluster it down to counties, I went up with my trailer and kept to myself camping for a few days. But where I was at, I don't know how you can just segregate to a county, because I saw people from several counties in the same trailer. Their license plates, I don't know that for sure, but their license plates were indicative that there were people from Utah and Ada County and one of our counties on this side of the state. It was, and sometimes it was, at one campground there were 4 different license plates from various places, and they were all staying in one tent, one huge tent. And so I understand some of this in terms of local basis, but if we've got it raging around us, then it looks like, just like if we got this from an origins in China, we could get this from the origins in Ada County or some other Arizona. I've seen some Arizona. Nobody, and I think I need you to speak about the people who are infected but don't show any symptoms, and if they are carriers, because I understand that can be fairly high. I'm going to let you explain.
Okay, so those are great questions and excellent points. So I'll try to break it down. I'll talk about the asymptomatic spread piece first. So this virus is very unique in that most viral infections, people do not have an efficient ability to spread the virus until they've been symptomatic for a couple of days. So I'll use flu influenza as an example. People really can't spread influenza until they've been symptomatic for 2 or 3 days. By that time, they already feel fairly crummy, so they're likely to be at home, and so less likely to spread it in the community. We know with this virus, and this is unusual, that people are able to spread this virus 2 to 3 days before they start developing symptoms, and also there are some people who never show symptoms. Those are a couple of the reasons that measures like this and the physical distancing, the hand washing are very, very important, because people can feel perfectly normal, have the virus and not realize it, go out in the community and spread the virus to other people, not intentionally, of course, because they don't even know they're infected. The very mobile nature of our society is definitely contributing to what you talked about, Councilman Bray. One area that we've had real concern about is the Bear Lake area, because that's a huge recreational area. The vast majority of people who come to North Beach, which is an Idaho State Park, are from northern Utah. If you take account of the license plates, it's about 80% Utah, 20% Idaho. We know that the Cache Valley and northern Utah right now are experiencing significant spread of the virus and big jumps in cases. So that is concerning to us. We actually had a meeting on Monday with the Bear Lake County Commissioners, the Governor's Office, State Parks and Rec, and some legislators to talk about what can we do differently at North Beach so that people are better able to physically distance. And that was prompted by concerned citizens who contacted us and the Bear Lake County Commissioners and said, this is out of control, you have to do something. So we had the conversation, and now they're making some positive changes to help reduce the likelihood that spread will happen there. But you are correct. We are a thoroughfare for any number of places, Yellowstone, Highland Park. And again, just another reason why those precautionary measures that are identified in the green section are really important now.
Maggie, I drove through Lava Hot Springs Sunday.
Yes.
The pool was absolutely jammed. Every parking space available for RVs and tents. They were packed 3 and 4 feet apart. It was every possible county and state you can think of was there. To me, in Bannock County, that's where we might have a problem.
So we have been getting complaints about that as well. So there's a wide continuum of perspective about the seriousness of this. And so again, when the governor transitioned So there has to be a willingness to engage and have a conversation about the issues. And we have not, well, we tackled Bear Lake. Lava is on our radar. But again, we have to have the support of the elected officials in that community to take some type of action. One of the things that the State Parks and Rec is going to do at North Beach is they typically let 800 cars in a day or at a time, and they've dropped that by 20% to 640. So that's going to allow for more space on that beach.
Is that total number, does it stipulate where they can be from? Is there any restrictions on
There
how
are
to
no
stay?
travel restrictions right now, but that is something that we might consider here. It's very hard to enforce. Even when in the governor's order, they were talking about anybody who traveled into the state had to implement a 14-day quarantine. The practical applicability of that is close to impossible. I mean, we don't know when someone drives across our border to go to Sun Valley or to Bear Lake or, up to the Island Park area. We don't know that. And even people who are flying in, you can't monitor that necessarily. So it's a good idea in theory. It's totally on the honor system.
So with that question, I know Utah tried to do some kind of when you come through and it blew up, and people in Tremont and their surrounding areas, every time they would do something, would get beeped and had to tell them that no, I live in Tremont. But
right.
Has that technology changed? Is there any way to be able to look at something like that, or?
So my understanding is that when they implemented that, it lasted for about a day and a half.
Yeah,
Because
it did.
You're right, it did blow up. And I have not seen anything that indicates that the technology has been refined enough to be able to apply it in a way that is useful.
Sounds good.
I did want to say that our partners at ISU, we just were talking yesterday about this and aligning their decision-making process with these metrics to the greatest extent possible. And we're very appreciative of that. And all our partnerships in the city and our region overall. Yes.
So from this last part of your presentation, when it comes to transmission and asymptomatic transmission, and it seems to me then that communication is the key, education, because people think that because, like me, I feel fine. I've not had any symptoms, but that doesn't mean I'm not a carrier monkey for this.
Right.
So, and I think that is the biggest obstacle, that people who don't have any symptoms don't think that they can spread anything.
So,
am I correct? I mean, would you agree with that?
I do agree. And, communication is an interesting challenge. So I can tell you that since our unified command was stood up in early March, we've issued probably over 120 was the last number I saw media releases. We do Facebook Live Monday through Friday every day. I think I've missed one day since we started this we started Facebook Live, I think, on the 13th of March. We do that Monday through Friday. We provide a numbers update. We talk regularly about the issue of symptomatic spread versus asymptomatic spread and the need for these. We have a strong presence on social media, and we're promoting messages via social media. And then the public information people from the city, the hospital, the Portland Health Trust, the school district, ISU, and the Pocatello Chamber we have done countless interviews with Item State Journal, with all of the broadcast media, including radio, trying to get those messages out. But there are a lot of messages out there, or voices out there. And so we're just one. And we've had a great partner in Matt Hunter and the Chamber. He has done a wonderful job pushing messaging and resources out to community businesses. So that's something that we continue to work on and will continue to work on, and we are very open to suggestions for how do we communicate differently.
And hasn't the city also been an active partner?
Oh, yes,
in
yeah.
that too? I just want to
Yes, Logan McDougall and Tracy McCulloch, who acts as our PIO, have worked hand in hand through this entire process.
The city has since March put over 1,000 social media posts out there with Southeast Idaho Public Health, and so you're seeing there's definitely a communication going out. Part of communication is actually stopping and listening to that, and we have a lot of people that are talking but nobody listening, and so the numbers are there that show that there's an education piece that's been going out. There has been information that has been distributed throughout the community on social media, on radios, on TV, everything I know Logan told me not yesterday, but last week that they had sent out over 1,000 different posts to get the information out. So part of the information gathering is we've got to be willing to gather it. It's being pushed.
Yeah, I have two comments, and one is years and years ago when I took some communication and advertising classes. And I'm sure the research has changed since then, but even back then, the accepted information was that in order to even break through, if a person wasn't looking actively, in order to break through, you had to have 3 impressions in a very short period of time, as in 15 minutes. Because neurologically, our brains make all kinds of decisions for us based on our sense of urgency or curiosity or whatever that we don't even know they're making. Our brains just eject information that it believes is useless. So that's one comment, that if I'm not looking to buy a lawnmower, you can have the best lawnmower ad on the planet, and it's going to be meaningless to me. And the other one, thinking of Doug, wherever you are, thinking of the age-old education issue, which is the teacher, the purveyor of information, can be doing a stellar job. But what we really need to be measuring if we care about effectiveness is what is happening on the learner end. So I have no doubt that we've done an excellent job of teaching, but I believe we have some evidence that our learners are not learning at the rate we would hope.
Let me do a little something right now, because it's about 10 after 10 and Ms. Mann's been talking for a bit. I'd like to give the docs in the audience and Mr. Gregson a chance to throw in for us a couple minutes to sort of come over here and fill in their perspectives, and then I think we'll be ready either for, I don't know if you need a 5 or 10 minute break, or if we can just keep on going. We've got Dr. Newhouse on the phone, so.
Before Maggie, I was going to ask this question. Could lava be the critical point that shuts down Bannock County? In other words, if there's a huge infection rate going at lava, and we have a significant percentage of our people that go down there, could it actually be a point that falls on Pocatello and Chubbuck because of the interaction. We have a lot of people doing it.
There's certainly that potential.
Could I just speak to that real quick? We have cases active on campus right now, and one of those points of contact was Lattle Hot Springs. They're in the dorms. If we had a full campus of dorms, which won't be full this fall, that could be the kind of event that could close down campus, and obviously that could interact with the rest of the community. So I guess the answer to your question is that's definitely possible, and in fact we have evidence right now that infections have occurred. They've spread to campus. We've had to deal with that in terms of managing the dorms right now, and that's with only a handful of students on campus. And those kinds of common source exposures, where there's a, maybe you heard the term, super spreader event, could definitely spill over and create all kinds of problems in the community.
Thank you. So let me give Ms. Mann a chance to take a breath. And thank you for all that information. It's very, very useful. But we've got a number of other folks that have come, and I want to give people a chance to make a comment or two. So I'm not sure who wants to start. Maybe I'll just start with Dr. Cree. You're there, and I'll just work my way around and try to catch folks.
Thank you, members of the City Council, Mayor Bland. I think you're doing exactly the right thing and the right process, and I commend you. You've got major institutions in the healthcare community who are here and testifying to you, and you're listening to them, and I think that's a wonderful process. I've worked with ISU and with the health department, and I think I represent the majority of family physicians in the community. I've trained a lot of them as a director here since 1996. And I would tell you that the family physicians in here, in this community, would wish that you would recommend masks to protect their patients. Working for ISU, as the chair of the Department of Family Medicine, ISU is wearing masks, washing hands, keeping distance, and trying to open. They need the help of the City Council so that they can stay open and be protected. The hospital has a large community of very, very committed healthcare workers. They need protection, not just of their own protective equipment, but from the City Council, so that they can continue to maintain their good services. I think the most telling piece of evidence about masks, and I will just focus on that, is that you've got major worldwide population studies of countries that put into place social distancing and hand washing, or social distancing, hand washing, and masks. The countries and counties that put that into place had a twofold difference in case rates. It halved the case rates if you added masks to hand washing. Dr. De La Rosa said to you, I've been wearing masks 8 hours a day for the last 20 years. If you had your chest open, would you prefer you didn't wear a mask? Think about it. And I'm sorry, I'm going to get personal here. I dropped dead a year ago. His paramedics picked me up, took me to hospital, and I was revived. I have lousy coronary artery disease. I take a drug every morning that keeps my stents open. If I got COVID, I'm dead, because there is a cascade of clotting factors that would just kill me. The drug would not work. So I went to Steve Wieg and said, if I'm going to be in a room with people, I would like them to wear masks, because I'm a vulnerable elderly adult. Now, one person in this room who hasn't worn a mask has stroked his nose and his beard 23 times in the last half hour. in my terms, his hands are microbially filthy. And the concept that I am sitting 12 feet away from him is not safe enough. I had a patient yesterday who I think may have COVID. I was very careful. I would not dream of coming to this room without a mask on to protect you. I would hope for the same facility and responsibility from those around me. That's the kind of thinking that I think you have to think about. As a teacher, I try and project a lesson which is personal. I'm sorry if it's offensive. Thank you.
Thank you. Dr. Solberg?
Thank you all for having us here. I spent the last 3 months of my life dealing with coronavirus with the university and reading articles and learning everything I can about coronavirus, including all of the public health measures to try to better and best inform Idaho State University and my role with them for coronavirus mitigation. So I probably have like 20 minutes or something that I could spend going over details and facts of it. Do masks work? There's a study, cage with sick animals in it, hamsters, cage over here with well animals in it, no contact, no physical contact between the two. They blew air over the caged animals who are sick into the caged animals who are well. 12 animals in this cage, hamsters, 9 of them got coronavirus. They used masks, a simple mask, wrapped this cage in mask on this face, blew air from the sick animal cage into the well animal cage. 2 hamsters got coronavirus. That's just a very, very simple, very graphic way of saying masks work. When they reversed the masks and put them the other side out, on the well animal cage, it was 3 or 4 got illness. So they definitely work in one way. They're built to be working in one way. To answer your question as well, those animals in the second cage that got coronavirus, when there were only 2 of them that got coronavirus, they had lower viral loads of coronavirus. Whether that translates to a change in clinical status, will those mice be less ill over time, we don't know. So there is a clue, there is data saying that the viral loads are lower, and that data also has been reproduced in humans who have been exposed to coronavirus.
And that's what I was talking about earlier. I just didn't articulate it as well as you did because I don't live in your world. But, but that's exactly what I was reading, the viral load.
The viral load was lower, but to Dr. Fernandez's point, well, once you have the virus, will it just reproduce and go crazy and make the person just as ill? The chances of catching the virus are clearly related to viral load. The more virus you're exposed to, the more likely you are to get the disease. So if we can decrease disease spread with simple using masks, that is a huge advantage. An estimate in the article already referred to today that was printed that if we get 60% of people using masks correctly 60% of the time, that may be enough to drop the contagion rate low enough to put a lid on the infections. Dr. Cree made the comment about individuals not wearing masks. Why do I wear a mask indoors? My rule is I wear a mask indoors anytime I can see somebody or anytime somebody has walked through a space. Because as we're walking along, particularly the heavier activity we do, the more activity we do, the more intense activity we do, we're blowing out more and more particles into the air. And then I'm coming along and walking through the cloud particle of the person who just passed through that space. So indoors, where you don't have very good air circulation, as I've been sitting here, this is a pretty stale room, these particles can stay suspended for hours, days, so that Distance alone indoors, in my opinion, and I think the data supports it, is not sufficient. That mask and distance indoors is needed. Outdoors, because of increased air movement and increased airflow, if people can stay 6 feet apart, probably sufficient to prevent the spread of coronavirus. But if people are coming within 6 feet outdoors, masks are still important. The green, yellow, orange, red levels of alert, all of those presuppose that the major 6 points of public health measures will be introduced in all of those. So that when we're in green level, that doesn't mean we suddenly don't wear masks. That doesn't mean we suddenly stop 6-foot distancing. That doesn't mean we stop washing our hands and doing all those other public health measures. Those levels all presume that those are going on all the time anyway. My analogy is, as a society, choosing not to wear masks as a society is like running into a telephone pole and then putting your seatbelt on. You don't want to wait until you run into the telephone pole to have the safety measure in place. You don't want to wait until coronavirus is overwhelming the community to have the safety measure in place. It is a preventative safety measure to be done ahead of time, rather than waiting afterwards. I'm old enough to have lived through the time when seatbelts weren't required. How well I remember as a child riding around in vehicles with no seatbelts. And to remember the outrage that occurred when seatbelts came into place. They were initially voluntary, then they were required, then there were police law enforcement for requirement, and then the car companies started making devices where the individuals didn't have the choice whether or not they wore a seatbelt, but they got put on immediately. Now it's just standard. Everybody wears seatbelts. I mean, this is just standard behavior. Not everybody. There are a few people who decide to take risks and not wear seatbelts. It's just standard behavior. It's what everybody does. In that case, we had the luxury of a decade or two to overcome the educational problems that we're having currently. We don't have that luxury now. We don't have a decade to help people understand how important the safety measures are. But this is exactly analogous. I remember this from seatbelt times. Exactly the same thing occurred. Asian countries have worn masks for years. Anytime I've traveled to an Asian country, it's probably a third of the time that I see people wearing masks. If there were significant health risks from wearing masks, we would know about it. We would know. I mean, there are millions and millions of people who've worn masks daily for decades, and we would know if there's a safety problem. I know you all received concerns about increased CO2 or decreased CO2 retention. The body makes up for that. We put on a mask, there's a slight increase in our carbon dioxide levels. We just breathe more for it. It's automatic. There's no danger in CO2 levels. There are good studies showing that CO2 levels stay exactly the same with or without a mask. It has no effect on the immune system. The one study that they sent to all the council members from 2015, British Medical Journal, saying that there was an increased infection rate with masks. They forgot to tell you that the control group all wore masks. There was no non-mask group in that study. The people who are using that study say this proves that we're actually increasing our infection rates by wearing masks. They had a group that wore surgical masks. They had a group that wore any old mask that they wanted, whether it be cloth or surgical, and they had a group that wore just cloth masks. The Institutional Review Board, which is the organization that looks over research studies, would not allow them to do a maskless group. That was hospitalized. That was healthcare workers in the hospital who worked in the emergency room, in the ICU, in the pediatric floor, and the infectious disease ward. The ethical body that reviewed that research would not allow them to do an arm without a mask because it was unethical, because the effectiveness of masks has been proven. It is scientific fact. I think the spread would probably be about 90-10. 90% of all doctors and scientists in the field would agree wholeheartedly that masks are worthwhile and need to be pursued. 10% would say the data is still out. I don't know of anybody who knows the data well and has studied it well who says masks are harmful or masks should not be introduced. That's probably enough for me. Questions for me? I'm happy to retake any of the questions you talked about before.
I just wanted to comment to both you and Dr. Creed's reference to foreign countries that have implemented masks. And I was reading an article about Vietnam and how they haven't had any deaths due from COVID. And they're very densely, they live very closely together. But early on, and they have a border with China, but very early on, they started this huge push with educating and engaging people in wanting to wear the masks so that they didn't get sick. Now, they still had an economic impact from the COVID, but they haven't had what's going on in Arizona, what's going on in Texas, what's going on in Florida. They haven't had that. And I just think that that's very telling because those are people who live, large numbers of people live together in small housing and they're constantly together, and yet it's made a difference.
And I think that some of that is societal. The Asian countries tend to see their responsibility to community as being more important than their responsibility to self. Our country is not built that way. Responsibility to self and responsibility to individual is primary in our country. Responsibility to others usually takes second place.
Dr. Stolberg, you mentioned a study, rudimentary as it was, with hamsters.
Hamsters, yeah.
And you mentioned that they put a mask on the side of the cage and then they flip the mask. Well, that made me think, what mask do we use? We've been told that any piece of cloth will work, but
the data in that article that they sent to you all saying that masks may increase the risk of death, the data all indicates that surgical masks do better than cloth face masks. I think there's pretty good consensus on that. That's why I'm wearing a surgical mask now. Previously and commonly I wear my neck gaiter that I wear when I'm skiing. But any mask, any face covering is better than nothing. The problem we're still having is acquiring masks and acquiring supplies. That we still can't get enough personal protective equipment for our healthcare providers. So that anything is better than nothing, and surgical masks are better than cloth face masks, as best we can tell. A limited number of studies. I'm talking 2 or 3 that have given that signal.
Okay. Rick, I think had a question.
Address face shields. We've seen a lot of publicity the last few days. Are those effective at all?
We don't know. We don't have a lot of data about it. He's asking about face shields. There are a number of them that are available. They're just clear plastic things that go in front of the face. There are quite a number of varieties of them. I don't remember where it was. When I was down in Utah this past week, a friend of mine needed to get a coronavirus test done, and the people who were symptomatic, they had the full face shield that was sealed, and they had an air pack in their back that was blowing air into the face shield, so all of the air was being blown out, so there was no way the healthcare provider was getting any air coming in. Those are highly effective, incredibly highly effective. They're very uncomfortable, they're very hot, nobody will wear them. I mean, and they shouldn't be used except for those extreme settings, like the healthcare setting. The plain face shields, the problem is droplets will still escape around the face shield, so that they may be of some help because the big droplets will impact on the inside of the face shield, but the smaller droplets will still get around. All of that is really confusing as well because there's talk about droplets and aerosols, and it gets into the size of the droplets is the distinction. It seems rather artificial to me. When we cough out, we get big droplets, we get small droplets, and get really small droplets. So the big droplets, if they're splattered on the face shield, probably help. The rest of it, probably not a lot of help. At Idaho State University, as we're developing policies, it's probably better than nothing. So the person with really advanced lung disease who can't tolerate wearing a mask, a face shield is probably better than nothing. to try to prevent the spread from them to others. And part of what makes it confusing as well is I wear a mask so that when I'm talking, speaking, my droplets get absorbed by the mask. They don't get out in the environment for you all to breathe. Recent data also says that I'm protected from you by my wearing a mask, that there is a decreased infection rate to me of running into your droplets because of wearing a mask, so that it helps both directions. It's not just protecting you all from me. My wearing a mask also protects me from you to some degree. So face shields are, they can have an additive effect to wearing, like when we're seeing coronavirus patients in our clinic, we all are wearing the N95 masks, the really tightly fit ones that are moderately uncomfortable. N95 masks, and we're wearing face shields, and we're wearing gloves, and we're wearing gowns.
Got a couple questions. Go ahead.
Yeah, I had mine up for a while.
Okay.
A couple of things back to some studies of other countries. I wondered if you could say something about Sweden too, because I know a lot of the Asian countries have shown success with wearing masks, and I think Sweden might be a good example of what happens when you don't put any of these policies into place. They're kind of a failed example, so I wondered if you could say something about that. And then also, while I have a chance, a couple of other things that you and I have talked about, but I thought if you could share with people in terms of some of the problems that people think masks cause, like the issue of they don't allow for detoxification, they suppress or in some way harm the immune system. Could you address a couple of those other things?
Sure. The Sweden example, I would have to look at specific data. I don't know. I reviewed one of their research articles about a month ago and don't remember it now.
Everything I've read about it suggests that they didn't do a quarantine. They didn't make people stay at home. They didn't make people wear masks. They didn't implement those measures, and by all accounts, it's a failed experiment. Their rates are second only, I believe, to the U.S., or they were last week. I'm not sure where they're at now, but so that seemed to be an example showing the opposite of what like Japan or Vietnam or some of these other countries have shown. But some of those other things, if you could tell us.
Yeah, toxins. Well, the only toxins we blow out through our lungs is carbon dioxide. There isn't another toxin we're getting rid of out of our body by breathing. Our other toxins get lost through feces and urine, not breathing out. So there isn't another toxin that's breathed out. There's no effect on the immune system by wearing a mask, because the immune system has nothing to do with clothing or wearing a mask.
So the idea that by wearing masks, we are not helping our immune system get stronger, and therefore we're less able to fight off virus. Is that? No data to support that. And probably where they're coming from is with really young children. Under 1 year of age, there's increasing data saying that they need to be exposed to environmental contaminants. They need to be out in the dirt playing and eating dirt. They need to be getting the viruses. They need to be exposed to the world in order for their immune system to develop properly. But that immune system development is really in the first couple of years of life. After that, our immune systems are intact, they're up and running, they are the way they are. Being re-exposed to viruses recurrently doesn't bolster our immune system or make it stronger. It makes us resistant to more viruses, but it doesn't change the underlying structure or mechanism of the immune system. So voluntarily exposing myself to viruses at my age to increase my immune system doesn't work that way.
Ms. Stevens?
Yes, one of the concerns that I've heard from folks is that if you're a carrier and you don't know it, if you're infected and you don't know it, that you exhale and you actually trap the exhaled virus in the mask, which then, in essence, would increase your inhaled viral load, therefore making masks for unknown, well, for anyone who's infected, known or unknown, more dangerous than not. And I'm wondering if you could speak to that.
Yeah, that's bogus. Next question. No. So every time we breathe in and breathe out, we have about 150 cc's, 5 ounces. I'll use apological units, about 5 ounces of air that sits in our airways. By adding a mask, we add maybe an ounce extra to that. So that process happens normally, that our airways are filled with old air and bad air that we have to breathe back in. And the mask increases that by about 20%. Once somebody has the virus, they have the virus. I've never ever heard of this rebreathing the virus theory. The funny thing is, they are actually saying exactly what we are saying, that we're trapping the virus by the mask so that it doesn't get out into the environment. I find the reasoning also somewhat circular. But no, that idea that by rebreathing your own virus, you're going to make yourself sick. No, not true. No data.
Thank you.
Councilman Gray.
You seem to have read very widely on this. We know that the health department has indicators of how this is spreading, but also we've also had some people, and there may be somebody in the audience that can speak to this. There have been some indications that one of the best sources for diagnosing or understanding where a community is to take the viral load of the waste treatment plant, and it's much quicker. You don't have to count on people coming in because it's going to be delivered to you. And so it's a clear analysis of what's going on. Could you speak to that for a minute?
Absolutely. The long and short of it is it's not ready for prime time yet, and I'll give you the reason why. University, I think it was Utah State University, in conjunction with BYU, and I think one of the national organizations just happened to be running. They already had their grants and stuff and were running that in Logan at the time the Logan outbreak occurred. And they saw, I think it was 6 days before it became apparent in the community, before the other testing apparatuses found out. In other words, people became sick, people were getting positive tests, they were showing up at the hospital and showing up at the doctor's office. So they detected the burst of virus in the sewer system about 6 days before we knew anyway, because people were getting sick. The problem is, so it was just fortuitous that they happened to be doing that. The problem is, we don't know how to relate that viral load in the sewer system to how many people are sick in the community. The data isn't there yet. There hasn't been enough study and enough research done so that viral loads are in copies per milliliter. So we have 1 million copies per milliliter or 10 million copies per milliliter. How many people in the community have disease? Based on that number, no data to help us to tell that. We'll probably have that data in about 6 months. The research is going on pretty actively. A number of large cities, I read Boston and Los Angeles, maybe Chicago, are doing that research to see if they can do it. I think they're also looking at it to see if they can track upstream to see if it's a specific nursing home or a specific meat packing plant that is the source of the infection. So the 6-day advantage of, we know 6 days before a big surge hits in the community, yeah, it's an advantage, but not a huge advantage, in my opinion. I mean, it'll become apparent anyway. And again, we don't know how to relate those dual viral loads to how many people are infected in the community to give us any idea about what we need to change in public health measures. So that's my long and short, is it's not ready for prime time.
Could I ask Dr. Newhouse to speak to that, please?
Sure.
And he's on vacation, so if we could let him have his time so that then he can get back to his family.
He was next.
Okay. But I would just ask Dr. Newhouse to speak to that, the testing of the wastewater. I know he's been speaking to the woman who's been running that experiment, that pilot program in Utah, and I know that he's got some insights in there too.
Dr. Newhouse, go ahead.
Yeah, hey folks. So let me just kind of start from the beginning, and I'll try to make this short and as cogent as I possibly can. But I've been in the community for 27 years as an orthopedic surgeon and now as Chief Medical Officer of Brigham Healthcare. I'm also still working with Idaho State University. So I've got a vested interest not just in Pocatello, but also throughout the healthcare district and with the university. So, a couple comments. This is everybody's first pandemic, and in a lot of ways, we're scratching our head and making this up as we go along. As my brother says, a year in COVID terms is every 2 weeks. It seems that everything changes, which makes it very confusing, especially if you're not like Dr. Solbrig, me, and some of my other colleagues who are just kind of up to our elbows in this every day. It really does get confusing and hard, and I certainly understand that. I would make a couple points. Viruses are not Democrat and viruses are not Republican. They're biocontagions, and we need to keep that in mind. And we need to try to keep public health policy at the forefront. Nobody likes this, but I would say that the data, and I would agree with Dr. Solberg, Dr. Cree, and the rest of my colleagues, is that I think that wearing masks does help, and I think it's going to become a best practice. We talked about asymptomatic shedders. And then the other concept I want to bring up is that every asymptomatic shedder, everybody who gets this disease, has the potential to spread it to somebody or many people in the community. And if we can cut down from having each person spread it to 2 or 3 or 4 people to spread it to less than 1 people, we can cut down this pandemic very, very quickly. And that's going to be really important. I've heard the argument that, Idahoans are independent and won't wear masks. I hear that. I understand that. I get that. I consider myself an Idahoan. But I can also tell you that as of this morning, 25 states in our union, that's half, already have mandatory masking requirements, including Texas. Now, I'm from Ohio originally. I think we can outplay Texas in football all day long. But I would say Texans are pretty independent. And if Texans can do it, I would say that Idahoans are able to do it too. So I would ask this body to lead, and I would fall in step with the rest of my colleagues and recommend mandatory masking. Now, going back to the notion of wastewater. So what we're dealing with here in public health terms is something called leading and lagging indicators. So if you get sick, have a cough, go to the doctor, get your brain biopsied with a nose swab, send it off somewhere. Right now, unfortunately, the labs are behind 5, 6, 7, 8 days. So by the time you get your test back that says you're positive, it's kind of game over. And if you look at that in a population, by the time the fire is detected, it's already come through your community. So we're trying to figure out ways that we can predict where the virus is coming, not where it's been. So I agree with Ron right now that the data is granular from the folks in Utah, but I don't think that's a reason not to engage. And I've already reached out to the woman who runs the public waterworks in Salt Lake City, who's put me in contact with folks at Utah State, who's already said that we have the ability at ISU to do the PCR testing to do this. And so that's something I would probably get people that are way smarter when it comes to basic science and virology and wastewater than me together and start working on it. The other company that I've engaged is a company called Kinsa. They also go by the term of, I believe it's called a health weather. And what they have done is they have put Bluetooth-enabled thermometers in populations that tell you to take your temperature every morning, upload it to an app, which then goes to an aggregated data set. And they can't tell you what your temperature is, but they can look at temperatures in populations and figure out when spikes in temperatures are coming on, because they've got normative data where they already know where your population should be. This would be another indicator that if all of a sudden your population is running hot, so to speak, you should be able to predict outbreaks. But as we go down the next 1.5 to 2 years until potentially we get a vaccine, I think that looking at leading indicators is going to be important. The Kinsa Corporation is already engaged with Crush the Curve. They've already started reaching out to some of our state legislators. And I think that getting involved with these folks at a local level is probably something we want to at least flesh out to see if it's going to work or not. So those are my comments. I'll answer any questions you have for me. Thank you for inviting me.
Dr. Newhouse, could you repeat the name of that entity that was doing the temperature checking?
It's Kinsa. K as in Ken, I, N as in Noodle, S as in Sam, A.
Thank you. Dr. Solberg.
Thank you for your thoughts, Dr. Newhouse. Appreciating your engagement. if there is if we're doing the wastewater testing and we see a spike in the amount of coronavirus in the wastewater, what action will come out of that?
You know, Ron, I'm not a public official. In fact, I'm just a dumb country bone doc. But I think anything that we could do to figure out what's happening ahead of time, if we are going to engage in some sort of a green, yellow, red system, I think that data would probably play some role. Again, not my role to figure out exactly how that would work.
Thank you. Thank you.
Dr. Newhouse, would you say that if we had some of this predictive data, even if it's not ideal, and I agree with Dr. Solberg, it's not perfect, but if we saw increases in the wastewater, then we could let the public know with a green, yellow, red, or whatever color, just like we do with the fire danger, right? We know when things are dry, we tell people the fire danger is higher. So if we see increases in the wastewater, we could let the public know, hey, look, we're seeing more of this. Maybe now we're in yellow, or maybe, you know, would you agree that the predictive data would help in like a public warning system, so to speak?
The short answer is I don't know for sure, but going back to my opening comment, this is our first pandemic. I think that as we have roughly 13,000 students come back to our community in August, as we have our youngsters hopefully go back to school in the fall, we're going to be seeing a lot of transmission of airborne droplets, et cetera, et cetera. And I think whatever we can do to start collecting the data, scratching our head, and figure out what it looks like moving forward, the better, in my opinion. Because again, I don't think this is going to be the last flu season where we're going to have to deal with this. I think we're going to deal with it in 2020. And unless we come up with a vaccine, again, that may be hopeful, I don't know, but we're probably going to be dealing with it again in 2021. We heard early on that the sun's going to kill this, that it's going to go away, that the summer's going to be better. Well, clearly that didn't happen either. So again, I think the more proactive we are, the better.
So this is Dr. Newhouse, this is Stephen Wake. So this will be another tool in the toolbox. Obviously, if the virus increases in the waste stream, it may mean that we're a little bit too late in doing protective action. Actually, listening to all of you, I'm just reminded that my decision not to go on a racquetball court with 3 other people to play doubles is probably still smart for a 74-year-old guy. So anyway, Councilwoman Lurie.
I did want to just comment on that idea too of studying wastewater. I read a study about that actually a couple of months ago, and I forwarded the article to Levi Adams, our WPC superintendent, and just asked him, like, what do you think about this? And everything that you're saying is the issue. He said it's really interesting and could provide us information. The issue right now is, does it provide us useful information in enough time that we can do anything with? And that's the issue. So I think it's an area that certainly could become a tool and maybe needs more study. But how do you, like, if the study shows of your wastewater shows that it's there or shows hot spots, how do you then take that and use that to do something?
I think one of the things that points out is that we are in unknown territory.
Yeah.
And we're looking for a silver bullet that doesn't exist. And we have to make our best judgment based upon whatever data we have and how we can use that. And some data may be predictive, some may be interesting, and still needs to be done. But what we're able to do with it as we move forward, and the real challenge is, how well can we use what data we have, and how do we get good data, and then how can we work together as a community to move forward and sort of in agreement on how we do that, so that we don't step on each other's toes. We're moving quickly, and I wanted to get
Mr. Council, can I make one comment?
Sure.
It's kind of like Thanksgiving dinner. You got to get the turkey and the stuffing and the green beans all kind of cooking at the same time, or it doesn't come all out right at the end. So I do think we need to engage. I do think we want to be proactive, but I don't want to get so lost in the weeds that we lose the focus of this discussion. And the discussion is we do have data on masks. And I think that your council needs to make a decision on masks. And I would strongly encourage you to be proactive and mandate masking. Thank you.
Thank you. Mr. Gregson, do you want to comment on what's going on at the hospital at this point?
Good morning, Mayor and council members. Mark Rakes, I'm the interim CEO at Barton Medical Center. And who knew what I would be doing when I was in Portland during this time frame. As you may know, all I do now is 100% interim and have for the last 15 years. This is number 15. So I get to see a lot all over the country. Number one, thank you for the opportunity to be here to share information. And even more importantly, thank you and the community for the amazing support that you've shown the hospital and the team there that they're doing. We were very humbled by all the ways you showed thanks and appreciation to the things that the team were doing on an ongoing basis. We started early as we tried to. I vividly remember we were watching all this kind of unfolding in February, and I remember March 9th at 5 o'clock, the world seemed to change because we realized this is different. We need to do to the next level and what this is. So one of the first things we do is reach out to our partners throughout the region and say, we're not in this alone. We don't want to lead. We want to do what we do and say that and work very well with the team members to do that. So you've had an amazing group here that has come together to work on this. And I think part of the results are indicative of what you've been able to do and what's shown around here. We set up our incident command early. We met 3 times a day and in fact often changed what happened from the previous meeting because we were listening and learning and trying to implement things that were going on. We had, if you want to call it a luxury, of part of Ardent is that we have hospitals all over the country, 2 of which are in New Jersey. So we were able to be rapidly involved in hearing what was going on and kind of the line of fire on an early basis and think about, okay, well, that's good to know. We do this, change this, change this. So what we did was a lot of preparation for surges that fortunately to date have not been to that magnitude clearly. But we want you to know that we're doing everything we can to be absolutely prepared to take care of anybody and everybody. And the everybody is the important component here too. Because in the meantime, there's a lot of other people approaching and at the hospital for a lot of other reasons that we've done that. So we've worked really, really hard to make sure that all the care and treatment is there and available. As was mentioned before, I think our first biggest issue is testing. We have had continuously the equipment to do the testing for this from day one. We had the equipment, have the equipment. Our biggest factor was who knew in terms of the reagents that are necessary to run those tests were not in the supply that were going to be necessary to do this on a nationwide basis. And so clearly the immediate needs of those were shifted to the Northeast because it was life-saving opportunities to know. But that put us in a unique situation that's been described where we'd have somebody who've ruled everything else out and don't know what else it is. So they're a possible infected person, and therefore we're having to treat them as they are until we knew otherwise. So that meant we used a lot of supplies and resources and team members to do it. Our number one goal and objective from the beginning of this is our team and patient safety, because we knew we had to have a team safe to be able to take care of everybody that's going on. I'll note here that in fact, the state keeps track of these data, and we share and see it every day in terms of infections by healthcare providers. And most of those indications of exposure are coming from the community. It's not from being in the environment of the hospital. So that's our other concern, because it means our team is out in the community too, and if they're exposed, that means they may not be able to work to do the things that need to be done on a day-to-day basis. So that's extremely important for us. The plan, again, the access is the patient safety, and then also making sure we have available resources to take care of everybody. So we have worked hard to make sure that we had all the supplies that are necessary to be able to make that. We have had the supplies. Our company has been unbelievably diligent in getting whatever we needed, and quite frankly, the chairman's position was, I don't care what it costs, get it. And I don't want to know some places where we may have had to buy the things and how much we paid, but we always had what we needed and it had what we needed. Now, there's been days where it was really touch and go, and we've had to learn how to be very economizing in using those things, and that's not going to change because we're going to have to continue to do that. So we've had very, very few positive patients, as has been indicated, hospitalized here. This last weekend, we had a little bit of a warning call, and that is we've had several that have hit the hospital at the same time, okay? From all over the area. There's no sense of what the reason is, or there's no common denominator, but it's just kind of a, hey, heads up, we are not done with this. And we have to continue to stay focused because, in fact, we've had several. We've got it, we've managed it, but at the same time, we've had a lot of other patients that are there. This is our busier time of year. So, in fact, we're having to watch very closely our capacity with staffing and resources to take care of everybody, but we're monitoring that on a very, very close basis. You've heard about the Safe and Smart and Stay Open program, which we're supportive of. We also have another one that you're going to see that's out there, hopefully you're seeing, is that the hospital is a safe place to come. Our other concern, and we see this nationally, is that if people have other reasons to come, they've said, I don't know if I want to go to the hospital, and in fact have ended up showing up later for things that have been more complicated that could have been avoided could they have come earlier. So we have an extremely safe environment. We work really hard to make that be the case so that we can take care of everybody on an ongoing basis. So there's a lot of things that work in terms of being able to do that. Obviously, there's a lot of rapid education going on, work on vaccines. I mean, there's the amazing amount of time, as somebody characterized, 2020 has been an unusual leap year. 29 days in February, 300 days in March, 500 days in April, and so on. You know, I mean, it's been just amazing. But this has been a very short period of time, relatively speaking, but at the same time, the energy and the intellect that's on this is amazing. Our treatment protocols are getting more and more refined continuously, things that are working, things that aren't working, yeah, maybe that did work. There's just unbelievably fluidity that's what's going on in terms of learning and sharing that information. The vaccines research that would take years has happened in about 6 months. Now, we're not there yet, but I mean, that's the speed at which a lot of things are happening. So I think you need to be comforted to know that there's a lot of things going on out there. That's the segue to say that we still got to do everything we can to minimize the exposures, and masks are just another piece in that arsenal. Wash your hands, social distancing. If you're sick, stay home. You know, and then the masks, we used to say just cough in your sleeve, but we've learned that in fact the mask can even help us more to do that. So we're saying that's a good idea. All of our employees, everybody who's in the hospital, that comes in the hospital, gets a mask, wears a mask. In fact, all of our employees every morning fill out an app that says, have you been exposed, what's going on, including your temperature. And then when they show up at the hospital, they show that they completed this app that has come back and cleared them for work, and their temperature's checked at the door, as is everybody else. So we're trying to be super diligent to make sure we're having a safe environment, but we want to make sure we're managing everybody's healthcare needs to the extent that we have to with this, but keep learning from that. So I tell you that background because there's an awful lot of energy in this community that's done an awful lot well, because the numbers are really, really good compared to others. So guard it, protect it, do everything you can to actually manage that as best you can, using everything you can available to do that. So our plea is please wear masks. Should you choose to take an effort to make that mandatory, we're supportive of that, but it's another opportunity to be able to have people cared for and treated. We are going to continue to pray. I'm an optimist at heart. I don't know if I can do this otherwise. At the same time, we're being somewhat pessimistic in the sense that we are trying to make sure we're prepared for any surge that we would have now and for the foreseeable future. As it's also been characterized, we don't think this is going away. We're going to be dealing with this in some fashion for some period of time. So we need to be ready to continuously be able to do that. So with that, I'll stop because I know there's a lot of you need to do yet today. And only conclude by saying, you know, it's been a pleasure to be here. Hopefully for you, my tenure is coming to a close soon here. At the same time, you got a lot to be proud of in terms of what's here. And my final brag is, which I try and brag everywhere, is I don't know of any place else in the country that's got 100,000 population that has a level 2 trauma center with extensive intensive care services and a 5-star CMS hospital in that community. So you've got something special. You've got a great healthcare delivery system in the whole region. We work together. We want to keep working together with all the facilities to make sure that's the case. But you got something special, and I think something to be very proud of, because it took a lot of work to get there. At the same time, it's a lot of work to continue, and I know there's a lot of energy that's going to keep working on making that be the case. So thank you today.
Thanks. Go to Ms. Ortega and then the mayor.
I wanted to share some thoughts from Dr. Snell. He's the CMO at Port Neuf Medical. He's on vacation with his family in Lake Powell, so he emailed me this. I know that he has been working very closely with Dr. Newhouse with regard to this COVID. And I'm not going to read the whole thing. I just want to read a few pertinent comments from him. One is that we have to plan for this to be here for the duration. So I personally am not here to talk only about mandating masks. I'm here, and I've invited Dr. Newhouse and we worked with the mayor to make sure that the right people are in the room, because we need a comprehensive plan. It's not this, to me, this today is not just about we want to make people wear masks. We need a comprehensive plan, something like this. And to that end, Dr. Snell feels that not only should that be unified amongst the communities that were all affected, but he writes, and I quote, "We need to establish data points with triggers for increasing the strictness of whatever plan." He used the word ordinance, but I'm staying away from that word. Whatever plan we come up with. We need leading indicator information to help us make this decision. We have been focusing on hospitalizations, a trailing indicator of disease burden, and actual testing data. This is subject to testing availability that has been unreliable at best. So I just want to point out that the mask is one piece of a plan. It's just like the wastewater treatment testing. Wastewater testing would be a piece of a plan, so that we could let the public know that we're seeing increases. I know Dr. Snell and Dr. Newhouse both are very concerned about upcoming flu season, the regular flu season. And so if we're going to rely solely on hospitalizations and things like that, well, then we might be upside down on this by the time October rolls around, because we're going to have people sick with regular flu. So I just want to reiterate that for me today is about coming up with the bones of a comprehensive plan that we can all live with, that helps protect our community and keep our economy open, keep our businesses open, and keep us functioning as a society. And to that end, I just wanted to make sure Dr. Snell's thoughts were included.
Dr. Snell's been an amazing resource to us. I know working together with him, he's taking a well-deserved few days with his family. And as the health department's done, he's done Facebook Lives almost every day. He's slowed that down now too, but a lot of just continue to communicate. That's what we're doing a lot internally. So we are at your pleasure to do whatever we can to help, to be a part of this, but you've got a lot of talent in this room, in the community, in this area to be able to continue to help to maintain the numbers that you're doing and do just exactly that.
Mayor and then Ms. Stevens.
So I have 3 questions. One for Maggie, because I know if we take a break, then you're probably going to get out of here because you've got some stuff. So why don't I ask you that first? When will this plan, do you have any idea when this draft plan may become a plan, opposed to a draft plan?
Great question. So the Board of Health has to come together and review it and have discussion and make any revisions and then vote on adopting. And we are working within the parameters of open meeting law to try and identify a date that works for all 8 of them. We were hoping to meet next Thursday, but one member is not able to be there, and we we all believe that it's important for all 8 to participate. Technically, they can make decisions with a quorum, but we want everyone's input and to be part of the conversation. So at the latest, the last week of July, there will be a final decision on this.
Okay, thank you. And then 2 questions. First off, how full is the hospital now, total? Not COVID, but how full is the hospital?
We're reaching current capacity. I mean, just by virtue of, this is that time of year where that's the case. Now, what we've done is we put plans in place with we had plans in place. We re-implemented where we segregate the COVID patients to an area where they are specifically cared for and treated, so we can continue with other areas as business as usual as much as we can. At the same time, it's that busy time of year for us. It's just our traumas, it's just the busier time of year. There's just more activities and things going on. We've had to watch that. Now we're watching carefully in terms of if we have to regulate those things that we need to do in order to make sure that we've got capacity. But the good news is we haven't had any more in the last couple days in terms of COVID patients, but we continue to be busy. We watch that every day, multiple times a day, in terms of census and activities and issues and discharges, so it's pretty fluid, but we're not uncomfortable with where we are right now in terms of managing it. This is where we would expect to be to a certain degree. But this is the piece of the equation that makes us a little nervous, because we have to make sure we've got capacity to manage any other things, because we've seen in other parts of the country that change really rapidly, that those 8 become more immediately. So that's why we have to have surge plans in terms of capabilities. We have an extensive plan in the hospital to be able to do that, A, B, C, D, E, what ifs, in terms of how we manage this going forward.
So in this draft plan, it says the hospital's total bed capacity has reached 90% 2 to 3 times. We're getting full, but it doesn't sound like we're at 90% 2 to 3 times.
Yeah, this week we may be there a day or 2, but we also know what's going on. We've kind of plotted it out for the rest of the week, and no admissions and discharges and surgery schedules are such that it'll go into. Probably the biggest thing is last weekend, why that's the case, it just didn't slow down as much as it usually did over the weekend. So we got a little more action early in the week, but that's unusual in that sense. So we think we watch this totally all the time, and I think we're not uncomfortable where we are right now.
What about the ICU? How full is ICU right now?
ICU is pretty close to full right now in terms of number of patients. But again, that changes almost as we're sitting here in terms of patients progressing to be able to move them elsewhere in the hospital to free up the space for someone else who may come in who's got more severe symptoms and that needs that space.
Okay. Thank you.
So it's very fluid.
These are questions for Maggie, because I know you're getting out of here shortly. Just for everybody's clarity, particularly at home, what stage are we in, or what color are we in currently based on your best estimate?
So based on the data in our draft plan, we would be in the green, okay?
Okay.
But I will share with you, we just started receiving these White House reports, and I just got a new one last night, so I will circulate this as well.
Okay.
They look at some different metrics, and that's the thing. There are lots of different models out there floating around. This is published by the White House, and if you take a look at page 3, for the state of Idaho, they do identify Idaho Falls, Pocatello, Blackfoot, Rexburg, and they include Logan because of its proximity, are all in the yellow zone, as are Bonneville, Bannock, Bingham, Madison, Franklin County, which are all within our 2 public health districts. And that's based on the metrics that they were looking at, one of which is percent positivity for tests, which in mid-June, we dropped to one of our lowest percent positive weeks at 2.7% of tests were coming back as positive, and that's great. We would like it to be at 5% or less. Currently, we're at 15.9% positive, and so we're about 11% higher than our target would be.
Do you have any prediction predictions based on the trends. And obviously, we're potentially in two different, depending on the metrics, we're in two different.
Right.
But regardless of what current stage, do you have any predictions or sense based on what we've been seeing in terms of trend? When or if we are heading toward another color, whatever color that might be.
Okay. So that's a really challenging question to answer. So what I can tell you is we have tended to lag behind the Boise area by several weeks, and they are experiencing a significant jump in cases. We know that there is back and forth between here and Boise. We had a cluster of cases about 10 days ago, a group that had gone to a party in the Boise area that they went to a number of downtown bars. They're all Pocatello residents, okay? So it's really challenging to make a prediction, especially absent the kind of leading indicators that are really solid, like Dr. Newhouse was talking about, Dr. Solberg referenced, Dr. Snell referenced. And given the current picture of testing, not only in our location, but also nationwide, it is taking, for many people, 7, 8, 9 days to get a test result back. That is really unacceptable. And it's because there is such a huge demand for testing on a national level. Our commercial labs, they don't have the resources that they need. And so because testing is so delayed right now, it creates barriers for us to be able to effectively contact trace and identify people who may either also benefit from testing or from limiting their activity for a brief period of time. So, I mean, I would completely be guessing if I tried to give you an answer to that.
And finally, what, if any, part in our metrics does our R number play, and do we have any idea of what our R number is looking like
Sorry,
today?
talking about R naught?
Yeah.
So,
yeah, how many people does
so
each person infect?
So right now for the state of Idaho, that value is at 1.2. We would like it to be at 1 or less. So we are right now, I think we're in like the top 10 or 12 nationwide for that value. It's one measure to look at, and so in essence what that means is for every confirmed case, they are potentially spreading it to 1.2 people. And so it's a consideration, and if you look on page 1 of this plan, down towards the bottom, it talks about, in addition to the metrics determining that are in here, we're going to look at other measures as well, and that's certainly one of them. I mean, I look at that pretty much every day. So it's a piece of the puzzle, definitely.
That's it. Thank you.
You're welcome.
Councilman Bray?
Maggie, you said we follow several weeks behind Boise. If we were to do an intervention and say we don't want to be like Boise, so we're going to get ahead of them, be smarter than Boise, and we want to do mass, would that help to curtail perhaps following Boise's trend?
I think that masks in combination with the other physical distancing measures, with hand washing, with staying home when you're sick, with upping, cleaning, and disinfecting absolutely can have a positive impact on the disease trend here.
So in some ways, if we were to trigger more attention on the fact that there are infections spreading in our state, and we want to be ahead of the curve rather than setting the curve, a mask could be a key component in doing it.
That's our perspective, yes.
Okay. So let me,
Can you guys go to a break?
Well, let me make a comment here, and then I'll let you. I think it's important for us to think a couple levels here. One is that as a community, we really need a comprehensive community plan going forward that's coordinated among key entities. A mask is a subset of that, and what I'm hearing today from everybody is the stuff that's in the green is something that we should all be doing. And the more all of us do the green, the better all of us will be. How we decide to do that and what role various players come together around, and this, that the district has maybe a template to build out from, because as a city, you're going to have to think about economic impacts maybe more than the health department has to think about them. And their primacy is health. Yours is going to be a little bit of a balance, but we have something to work from. We have some elements in place to work from. And I know that we've heard a lot of talk about masks today, and I think the question that's going to come back to the council is, you can be more restrictive faster than the district can be. You probably can't be less restrictive if they make a decision, but you could be more restrictive. So that's a decision you will may have to make. But the decision on a mask is a piece, but not the whole story. And I think that's what I've heard this morning. It's 11:15, and we haven't heard from Ms. Olson or the school district or the university, but I think, do people need 10 minutes to take a breather, or?
I need 5 for sure.
Or 5 for sure, okay.
There are other health concerns working on this.
Yes, pressing.
So I would say, yeah, let's take.
Pressing.
Can I ask one quick question, because I think we're going to lose.
Yeah, Ms. Maggie, you can ask a question.
So, Maggie, you've been working with ISU and with the school district, and I'm assuming they've looked at this draft plan, or they've at least been part of, or know of it. Are they considering following this plan? And I know we'll hear from both here in a minute, but...
The school district has their own roadmap plan, and it is connected to this in that they look to us to help determine what level of spread there is in the community. So their plan is very specific to their own operations, as it needs to be. It's a very well done plan. They're looking at multiple sort of ways to approach providing education and the services that kids need while protecting those students and their staff. So that's the connection there, is that where we are in that will help influence potentially, based on our dialogue, what they decide to do as far as instruction and delivery and that sort of thing.
Okay.
With ISU, Dr. Force and I just were speaking yesterday about getting, because this is brand new. Again, it's not even adopted yet. So working with them to align as well. Because, and Stephen and I have spoken about that alignment is going to be very critical.
Okay, perfect. Thank you.
All right, let's take 5. Take 5.
Are we going to be able to, rather than functioning locally from county?
I guess so. So let me, just to follow up before we get into some overall discussion, we haven't heard from the university, the school district, or Kathy Olson, and so what I'd like to do is give folks a couple of minutes to sort of speak up from your perspective, what you're seeing, thinking, hearing, doing, how that might fit with everyone else in terms of going forward. So whoever wants to go first. Kathy, you want to talk for a couple of minutes first?
Okay, I could do that.
Kathy has asked me to help her stay focused, so.
Yes. As a nurse for 44 years here, 42 in our community, it has been my career to help people do things that they don't want to do to stay well. I drag people out of bed, and when they hurt and have them deep breathe and cough, we would keep businesses open. If we have some businesses that ask for masks and other businesses that don't, then we have pockets of infection that can occur in our community, and the mixed message that we don't think masks are important in our community because our healthcare workers, our customers, our travelers through our community, and the people who are working in the facilities are not important because there is no unified message, then there is not the consistency that people need to know that they need to make a change. So masks increase the likelihood that we will be able to open our schools in the fall. If we start now with a mask plan, kids are going to be used to wearing masks, adults are going to be used to wearing masks, and things will be better for the movement towards schools. If we ask for masks from everyone, then nobody has to be the bad guy. Then we don't have somebody standing at the outside of a door saying, I should come in, because there's no guidance from anybody else. So I'm just asking the group to show courageous leadership and lead our community to a plan that means wellness for all. I understand that some people can't wear masks, but I know that the more we educate and the more that we teach and the more that we become accustomed to wearing a mask, the more possible it is for everyone to wear a mask. Wearing a mask will help businesses stay open. It'll help us open schools in the fall. It increases trust among consumers that the community is looking at safety and that businesses are safe for them to shop in. So I ask, what is the price that we're willing to pay to keep our economy open and our community safe? It is not just the cost of, do we have enough hospital beds and do we have enough drug to treat somebody who's ill? We need to be working to keep those people from becoming ill. Because the bottom line is, when our community becomes ill and people need health care services and they don't have insurance, or that we all help pay that. And then if they do have insurance, our insurance rates all go up because everyone is using more health care. So the scary thing I heard from my neighbor yesterday was that deaths are down in our community because we have a lot better drugs and because we have a lot more ventilators in our community. And I would just like you to think as a city council, is that true? So my mask protects you. Your mask protects me. A mask is a symbol of the caring of our community for each other. Thanks.
Thank you. Thank you. I'm not sure whether we want to start with the school district or the university. Who would like to make a...
I'd be happy to go.
Go ahead.
All right,
Mr. Hall.
thank you. Appreciate the opportunity to be here today to engage in this discussion with you. I appreciate the fact that we're looking at a community plan rather than perhaps just talking about some masks today. And our district is trying to be very proactive and present a plan to our community, to our staff, that aligns quite closely, I would say, with Maggie's plan. And we've been on the phone with her at least twice a week, sometimes once a week, I guess, but very close communication as we try to pursue what we would think is best to present to our board next week for adoption of that plan. And so currently we have a survey. Hopefully you've seen it in the media. Courtney is fantastic about getting our message out. We talked earlier about education. And that is our business, and we are very transparent in what we do. And so with that, we have a survey out to our community members, we have a survey out to our staff, and we are talking about these very issues. And as I mentioned, our board will encounter this discussion for themselves next week in regard to our plan. For the, we purchased personal protective equipment in regards to, and I appreciate Mr. Cheatham's thoughts or comments on the shield. Because if you think about the challenges in education, in younger grades, when students are learning to read and pronunciate the words, there's an opportunity that is missed with this mask, as well as relationships. When we try to build the relationships with children, if they can't see our face and can't read our expressions, that makes it a little bit difficult. So the shield, or as part of face coverings, it seems like the data is a little bit conflicting, perhaps, and if it would minimize the risk, then we would like to at least have an opportunity to use the shields again. Other challenges that we might face is social distancing or physical distancing, because schools were not meant to be physically distant. In fact, quite the opposite. So we have asked our teachers to eliminate those things in their classrooms that sometimes make them more fun and comfortable in order to allow more space between students and the teacher. Special populations, oftentimes, younger children or older children in that category may have a tendency to not keep the mask on or face covering, so we will encounter that along the way. We have had an opportunity to do, I would call it a pilot, in that we have an extended school year for our at-risk, our special populations. We ran that for about 5 weeks, and the staff members that were part of that were all willing to wear the shield or a mask, and so we didn't have any concerns there. Again, just with the students sometimes not being able to keep those on. Athletics, activities indoor and out. I know that you all will make a determination eventually, but it's likely it'll come before action, to determine whether or not inside or out. With activities, we had a call yesterday that one of the coaches out on the track was not wearing a mask. Again, as you heard, I think it was Dr. Solberg, who talked about the circulation of air and maybe not the exposure that would happen in an indoor setting. So that's another item that we're kind of wrestling with, the difficulty of enforcing that. And I think someone else spoke to that earlier today, and that will be perhaps a bit of a challenge for us. Staff, I think, are primarily in favor from what we've seen in the preliminary responses to our survey of wearing masks. Many of them are asking that we also require our students. And as the plan is written in draft form, we have written strongly encouraged. So the feedback we are receiving would indicate a strong desire to have learners in masks as well. And again, our staff would like to be back, I think. I know there was an article or paper published by American Academy of Pediatrics that said for the social, mental, emotional, academic, or intellectual health of students, they need to be with teachers. And we know the burden, too, that it causes on families to not have that available to them. So we want to be very proactive in our approach and to make that happen. Certainly our plan is fluid, and we could transition. We may not even get into our modified traditional approach. We may start with hybrid. We may start with remote, because everything in the next 6 weeks changes so drastically. And so we'll hope for the best, plan for the best, and we'll just see where we land. Again, with disinfecting, sanitization, mask, face shields, physical distancing, we will do all that we can to protect our staff and students.
So let me just clarify. If I heard correctly, from your perspective, for the education of children, being together with a teacher in a classroom is really critical.
Yes.
And a mask is maybe one of the best mechanisms to make that happen versus other things that you might be able to do.
From what I've read,
what you've read,
that would seem to be the case. Certainly, I'm not a medical professional, but again, from the indicators that we have, and again, with the board, we'll make that final decision next week for both our staff and our students. But we would, that's our recommendation to them.
Three hands, we'll start here and work our way down.
I have a few questions. First one, if we were to make masks mandatory and there were parents that didn't want their kids to be in that environment, there's some enforcement would fall on you because they would be neglecting their child's education.
To some extent, Councilman Brink, I think what we talked about is we would like to work in more of a cooperative approach. And so what we are exploring and will offer, I don't know what that will look like because of staffing and enrollment. So as we get closer, we'll be able to identify that. But we hope to offer an online learning program.
So you have an alternative.
An alternative for those that feel like they don't want to be back in the classroom or do not want to comply with the request for a mask.
Second thing, we received email from the Teachers Association here that showed the survey results, and it was kind of mixed bag there. But it was clear that there was a certain population of teachers that didn't feel like it was safe to go in the classroom right now. So can we do anything to help you give them assurance?
Hey, that is a tough question because some of our teachers may be vulnerable either by age or by health condition. However, we are still considered essential workers. And so we have a job to do. And if the opportunities exist that we can do that remotely or an online learning program for some of those folks, that is a possibility. But again, being essential workers, we would be back if that is the direction of our board.
Okay.
And so I don't know that there's anything that you could do specifically. Even the enforcement, I think, is just, that'll be difficult for all of us.
And a couple categories I couldn't tell because there were two categories for masks that were listed there. And they had some results that were positive, but the two categories for masks I couldn't really separate. I do know that nationally some of the polling on teachers is real indicative that there's a large percentage of teachers that don't feel safe going into classrooms. So if the spread of this, I guess it might, if we were able to curtail spread, do you think that would help?
Absolutely.
You know what I'm saying is, if we're proactive, we're doing things that rein us in more. We say we're a community that works, that tries to pull the levers we don't even know which we're pulling all the time. But we're trying to pull all of them we can to create a more safe environment. Do you think that would help you and your teachers?
So, thanks. And I think the survey you were referring to, Pocatello Education Association put together their own survey. They had some Zoom meeting. And so theirs is a little bit different than ours, but I'm sure the results would be somewhat similar.
Ms. Ortega.
I'm just wondering, I've heard, and I don't know if this is true, that the incidence of transmission from children is very, very low. Is there anything, do we know anything about that? I mean, I was watching C-SPAN the other day and somebody was going on about saying, you know, we know that children, it's very difficult. Children don't normally transmit the virus. So can either of you speak to that?
I have not studied that yet. That's on my agenda to read about and look into. I don't have enough data, enough knowledge of the literature to speak to that.
I think that there have been a lot of reports about asymptomatic carrying of the virus in children. That doesn't mean that they're not contagious. I think because the illness typically is less severe in younger individuals, We haven't seen as many studies, we haven't seen as much data because the research has been focused on the critically ill and those folks that have been most impacted by the disease. So Dr. Solbrig and I are constantly combing the literature to try to find the best practices and refine those best practices, and there isn't as much information in children right now.
I was just wondering, like,
Along those lines, the concern is if the children all get the virus and then they bring it back to their parents and then spread it to their grandparents, whether it's lower risk or lower rates, I don't know the data, but that's the concern from my perspective. How do we keep these few children from being infected and in order to keep it from being the nidus infection for the rest of the community?
I was just wondering, Doug, because some classrooms have carpet, many classrooms have carpet, and they also, when you mentioned asking teachers to eliminate the things that are make things more comfortable, immediately I thought about the sanitizing differences between a soft surface and a hard surface, and I'm wondering if the board has considered anything as stringent as simply saying if a soft surface object is not required in order to educate, please don't have it. Because I'm just thinking about even before all of this, my reluctance to sit down in a cushy chair that had been in that classroom for 15 years.
No discussion yet. Again, we did not get into quite that detail. However, the board may have some questions for us in that regard.
And maybe that's a question, I mean, as we're thinking about how to, and then just with high school kids, but middle school kids too, it appears now that there's some indication that one reason that younger folks may be getting symptomatic is because of smoking and vaping. And so, I hate to think about that particularly in middle school kids, but it's a reality. But particularly, I would think at the high school level. And I mean, you can't stop kids from doing that, but it seems to me that would be a really important communication piece, maybe to parents, that your kid is at increased risk, if that's true. And I don't know, does that data appear to be?
I think that what I've seen is a little bit of association. It doesn't necessarily prove cause and effect.
Right. No.
But that there does seem to be an increased risk, particularly with smoking because of lung function and vaping as well.
Right, thanks.
Good. Okay. Mr. Cheatham?
I'd just like to ask you, Doug, is your plan complete? Is it ready to launch? Is it at that state yet?
No, once the board, they've had a chance to review it along with the public. In fact, I sent them out kind of a first draft to take a look at before we were ready to release the second draft. And there are details of the plan that are not in there. There'll be more internal working kind of document. And in fact, we're in the process of developing a Q&A for our staff to help them better understand the details of the plan.
Does it treat all students K through 12 the same?
It does, and that's where there's a little bit of a difference. That's why it's strongly encouraged for our learners, because we've seen some research about could be masked up to 2 years or 2 years and older. And so, and as I mentioned earlier, that if we just said face coverings, then that allows for those learners in primary grades to have that social interaction piece, that relationship building piece. Again, that would be at the comfort level of the teacher to some degree as to what they would be willing to wear. But pronunciation, facial expression, that's all important for little ones.
Thank you.
So we've not designated any difference at this point.
There are some face coverings, sorry, I was just going to say that are like a mask, but they have a clear window. And so the question is how effective, there you go, how effective are those compared to the shield, which I think there's a little, I think there's more to being covered than a face shield in terms of protection. But we have similar issues at the university where we need to accommodate students that are deaf or hard of hearing and other folks that need to be able to read lips. And so we'll be doing similar things to be able to make sure that professors and instructors can have a clear face shield so that people can see their face.
And my question is both for Doug and Rex. You could go ahead and address this too. I think one of the biggest issues for all of us is not the science of whether masks work, but the enforcement issue. And we've all acknowledged that that's a challenge, but I'm curious at both, you know, within the school district and within the plan, and you've mentioned that that's a challenge, but how do you plan to address that? And I would ask the same thing about ISU, and I just wanted to relay a little bit of a personal story. I live right next to campus. I walk campus every day, every evening, all across campus, and I'm rarely seeing anyone wear a mask, and I'm seeing people play sports. Every evening there's several large groups of people playing soccer, volleyball, softball. So they're interacting, they're sweating, they're running around. None of them are wearing masks. So the enforcement issue, what is the plan in both of your areas to deal with that?
Okay, so as I mentioned, we're looking at perhaps, we would like to do our best to work cooperatively. Certainly those athletes that are on the field or on the court, we've talked about not requiring it of them, but anyone who's essentially congregating on the side. So we're reducing the possibility, but we're certainly not reducing it to the extent that this would while they're competing, if you will. And so for us, that's where we're at right now, but to keep things moving along, that may be something that we look at into the future. We did have a coach at Highland High School, and we shared that as soon as we were aware of it, and what steps we were taking, again, to provide the tracing, to alert the families involved, to shut down the facility for the days required, again, working with Maggie very closely on that. So I want to say that was a wake-up call, but it certainly gave us cause for concern and to ramp up what we're doing at district level, and hence the mask that we wear when we're in meetings such as this, even if we feel like we're keeping the distance. And so we're trying to model what we would like for our learners, our staff, and our athletes. I don't know, did that answer your question?
Yeah, and if we were to pass an ordinance or a mandate or whatever we want to call it, then that would kind of supersede. I mean, you'd still have some enforcement, as Roger mentioned, within your area, but ours would sort of supersede your plan, is that?
Certainly would.
Okay.
Yeah, at least in all but 3 of our schools, which are looking at each other.
Right.
Yeah.
And Rex, before you answer, I would just say, because you mentioned athletes, and what I've seen and see every evening is informal gatherings of students who happen to still be here on campus, not team sports that, is a different thing. So, but both of them are different groups that need to be addressed. So I'm curious what the plan is.
And that's where I think an ordinance would be very, very helpful, right? Or whatever we term it, because intercollegiate athletics, Big Sky Conference athletics. I actually sit on the Big Sky Conference Return to Play committee. It is a mess, and obviously every week things have changed, right? You've probably heard that several conferences around the country have called their seasons already. Ivy League and Patriot League, I believe, have. Some of the others have cut back on the competition. So intercollegiate athletics is a moving target, and even the practicing that's going on has been impacted by COVID on our campus because of cases in our student athletes, for example. And that's been associated with travel and otherwise. The enforcement on campus in general, we do have the expectation that face coverings are worn by all of our employees. And so it could become an HR-related issue on campus because that is the expectation. There are exceptions, and we will grant those exceptions. We have alternatives such as face shields that may be used in certain situations. You heard Dr. De La Rosa talk about kind of the claustrophobic feeling that some have. My mask isn't fitting great. My glasses fog all the time. I'd like to get a different fit, but I need to be Bengal branded today. I saw that. But for students, the question is, well, what happens if a student walks into a classroom and says, no, I'm not wearing a mask? We're working on that guidance that we will give professors. It may be that those classes will be moved to online because that obviously is considered a risk to the rest of the class. And so we may, and we haven't ironed out all of these policies quite yet, but we may be saying to our professors, if you're not comfortable because of that you can move your class to online. And we have literally, I think it's 9 or 10 different delivery methods for our courses that have been outlined already in terms of hybrids between online, live, in-person, distanced, all of those kinds of things. And I guess I can just transition into some of what our plan is, unless you have other questions for the school district.
I have one.
Okay.
Doug, you talked about athletics. What about spectators? Are you going to ban them or require masks of them?
Well, I hope that we still have an opportunity to compete this year in fall. But we reached out to out of state, and because a majority of our home games, at least with varsity, are there at Holt Arena. And there would be an opportunity there to distance, and I think the university has a plan for home games. And so we would just model after that pattern. Our schools indoors, say for volleyball, we may have to limit the number of spectators, give athletes tickets to distribute, that sort of thing. We've not gotten into that detail yet. But again, these plans are constantly evolving and even changing to some degree. So I don't have a perfect answer for you, but it's something that we're looking to address. Yeah, we'll see where we're at in the fall. Again, the number of games that we have with junior varsity and freshmen, we can have those outside. We feel like our facilities will allow for that physical distance.
Thank you. Jim? Go ahead.
Linda, did you get your question, your original question completely answered?
Yeah.
You heard, okay. I just wanted to make sure we didn't kind of go off and leave part of your question unanswered. So is there any kind of fast track testing? Because I'm thinking of the 9-day and you find out that an athlete or a coach or whomever is maybe has been exposed, and then for 9 days, will they be quarantined? Is there fast track testing? What's that situation?
And I can speak to that. There's a new test that's available that is an immediate test where you get results. It takes 15 minutes to run the test. So realistically, we get it in an hour or two from the time we draw the test. The University Health Center is looking at purchasing a couple of those to serve the university community. The Health District, Southeast China Public Health, and Express Labs. Express Labs has been the laboratory from Idaho Falls that's been helping with our outdoor testing facility at Dyer Hall this entire summer, is also looking at purchasing a couple of those. They have the same problem that getting the equipment to begin with is in short supply. We're probably 6 to 8 weeks out from getting those available and up and running. And then they just learned yesterday that the Department of Health and Human Services has bought a large proportion of their machines to go into nursing homes throughout the country. So that we'll be competing with other entities that have higher need than what we have. So we're probably realistically 2 months away from having that available in the community for those very settings of you want to test the team prior to play. So.
And the other issue that brings up is utilization of those resources for that activity as opposed to dealing with sick people. Right. And so when you have a limited resource like that, yes, we'd like to get our teams back on the field. For example, our football or volleyball or women's soccer teams at ISU, they're talking about testing multiple times during the week before they then have the competition. There's an incredible cost that comes with that, let alone the use of that resource there instead of other places. So.
May I go back to Mr. Cheatham's question too? This is not a commercial, I promise, but in all of our gyms and also at Holt Arena, we have a camera system called Pixel-Lot, which will cover the games, and it's pretty amazing, really, for what that computerized camera can do as far as tracking the ball and the activities. And so we'll have that available too. So, I don't know.
Thank you. Can you sort of fill in on ISU? Let me sort of hold questions for a little bit so we get the ISU, because then we'll have sort of filled out the group.
Right. So, thank you all for having us. My name is Rex Forrest. I'm Vice President for Health Sciences at ISU. I've been at ISU for 27 years in a variety of different roles, and 4 years doing this job. ISU had the first case in the state. I don't know if you remember. I remember it well. It was Friday, March 13th on our Meridian campus, and it was a long night in dealing with this. It was associated with travel. That first case was. The individual had been to New York City, where cases were ramping up and brought the virus back. They did end up infecting at least one other individual. No one on our campus, though, was a family member that was affected. But we have been dealing with cases on our campus and impacting campus operations since that time, pretty much continuously, wouldn't you say? We've been either tracking or dealing with those cases. COVID has shut down our paramedic science program for a time. It has shut down our accelerated nursing training program in Meridian for a time. It has affected nurse practitioners, pharmacy students, PA students, and a multitude of other students. I'm most familiar with our health professions students. So it's made an impact, and it's already shown us what could happen if campus, we've already closed our campus, right? And then as we've sort of transitioned back towards being open, with that being our goal, that we are open, that we have on-campus live instruction. We understand there are risks associated with that, but our faculty and our students have asked for that. Clearly, the majority of individuals want to have campus experience and have that interaction. So that has been our goal, is how do we set up a safe and live in-person option for those students and faculty that are most interested in that. We have had to analyze our entire footprint of the campus to be able to then integrate social distancing, physical distancing, like you have here. We've had to do that in every classroom, in every space, and we are also looking at spaces that haven't been used for instruction in the past. The Performing Arts Center, for example, will likely be used for large classes with substantial distancing in like the Grand Concert Hall, if you've ever been into that large facility. We have several classes that have, hundreds of students that are in those, particularly 100 and 200 level classes. So our entire footprint has been analyzed, and thousands, literally 4 to 5, maybe 6,000 sections of classes have been analyzed, and we're figuring out where can we do this, how can we do it. Our days will likely be extended. We will have additional sections of courses to be able to accommodate the distancing, and face masks will be required on campus. We will have hand sanitizer stations, and we already do at the entrance to most of our buildings. We will talk with students and communicate about the need for this, and we will have flexible attendance policies because we don't want students to come to school sick. And so all of those things are changes and have been communicated out, but will be re-communicated and re-communicated again to our campus community. All of the events that we do have been analyzed and evaluated. We have a committee that's reviewed already 200 probably health exception types of requests related to outside community-facing events like having high school football games in Holt Arena, for example. What is the spacing going to be in Holt Arena? How are we going to manage that? We've communicated and worked very closely with Maggie Mann. We are centering our guidance on CDC recommendations. So as we build this out, we are utilizing the CDC as well as a lot of other guidance that's come for institutions of higher education. And so we have been working very, very hard to come up with a plan across all aspects of the university community to be able to create a safe environment. How are we going to handle choir classes? How are we going to handle anatomy, where people gather around a cadaver, for example? All of those things have had to be considered. Fortunately, in that setting, we have masks and we have other protective equipment and we have great air circulation in those facilities. But people come together and come together closely. How do you, as a professor, work with students who are working at computer stations doing graphic design, right? And having to get down there and look and be close together. So we are evaluating all of that and working to limit the possibility of spread because we want to remain open. But I think that's one reason we were grateful to be asked to come here today is because of the interconnectedness of the university community and the school district community to the rest of the community. And we're going to have, as Dr. Newhouse said, 13,000 people showing up here pretty quickly. 25% or so of those are students that come from out of state. And that is going to be really something that the whole community needs to work together to manage. We want that economic impact to make a difference in the community, and we want those students to be on campus making that economic impact because I'm sure it's substantial. And we feel that these disease mitigation efforts that we're trying to put in place on campus will allow us to maintain for as long as we can an in-campus, on-campus environment. We have shortened our semester, so we will be done at Thanksgiving because we don't want students to go away for Thanksgiving for 4 or 5 days and then potentially bring something back for only 2 more weeks of school. So we will have online finals or web-based finals for most of our courses after Thanksgiving, but the instruction will end before Thanksgiving. What else have we done? We've worked very closely to coordinate with Maggie and the health department. Dr. Solberg mentioned the drive-up testing site that's available at Dyer Hall. We're going to be moving that. We will leave Dyer Hall when our students start showing back up. We've worked with our housing programs to think about how are we going to quarantine students if they need to be quarantined. How are we going to de-densify, make our residence halls much less dense. If you think about it, Turner Hall there on campus is much like a cruise ship, right? And we've heard what happens on cruise ships. So there's shared facilities. The students are packed in there fairly close. We need to separate them out so our density of housing will be less. Although I think we can accommodate most of the students who want to live on campus, as it turns out. Right now, enrollment is looking pretty good. The projections in terms of registrations, people that have registered for class, is down about 4 or 5%. It's actually up for graduate students and professional students, particularly in the health sciences, we're happy to say. So that's a good thing. Many universities are talking about 20 or 30% reductions, which would be absolutely devastating for the ongoing financial solvency of the institution. We've managed budget cuts over the last several months that have been very, very impactful. So not having our classes full would be devastating to Idaho State University, and it would be to the other institutions in our state and across the country. We are, I think, very committed to taking a plan like Maggie outlined to you in the draft document with a green, yellow. We do want to include orange and red sort of stages, and being able to then integrate our operational plan into something like that. Meaning, we've worked for 4 months or more to get open in the fall in a new normal, but we realize we may have to retrench and reconfigure how we do things, even potentially moving back to online delivery in a worst case scenario. But that's not what we want to do. And so collaborating across the community in terms of disease mitigation, as well as the planning and the metrics that we use to reconfigure our operations, I think makes a lot of sense. And I'll stop there and answer questions if you have them about the ISU.
Thank you. I'm curious, the state of Alaska has implemented mandatory for people who are traveling into the state that they present the results of a 3-day or a 5-day test. Because you're having students come in, especially from states where the COVID has exploded, California, Arizona, Texas, are you going to be requiring anything like that? Or do you have anything like that in mind? Or
So we haven't actively considered testing before coming back to school. But what we are going to talk to students about is isolating before they come back to school. We have had students quarantine, especially over the summer, quarantine and isolate when they come back to campus. We've had situations where we couldn't do that because we had to get a program restarted. Some of our programs are still stalled. Dental hygiene students have not graduated because we have to totally reconfigure our dental hygiene clinic for a new normal. Okay? And in some of those cases, some of those students left for a time and then had to come back. In those cases, Dr. Solbring and I work with those programs to recommend isolation or temperature checks or other things in special situations to then be able to get them here. When we have 10,000 students come back, we are going to send out messaging about how to isolate themselves before they come back. In essence, quarantine before you get here, because our dorms don't open but 5 days before class. If I remember it, it's the 12th, right? And so we can't bring them back, isolate them in the dorms. It's going to be very difficult to do that anyway because of the interaction that students have and want to have. If you think about the college experience, it's everything that you shouldn't do to keep from getting COVID, right?
well, that's why I was asking about like the 3-day test for a 5-day, because if those kids come back and check in and they show that 3 days ago they were clear, then at least you know that.
You have a snapshot.
Right.
And I can address that a little bit as well. This summertime we had, I think it was about 60 students come in from all over the country, a pretty good representation of what we're going to be dealing with, into the residence halls. The residence hall staff was very, very careful and very informative and a lot of education of isolate yourself at home for 2 weeks before coming back. I had looked at devising a testing policy and procedure for that group. I couldn't come up with a meaningful way to do that at that point in time. How do I pick which country, which state, which county do we require people to get a test from and which do we not? So we went forward without doing any testing as they were returning. We had 0 cases out of that. All of the cases that have developed because of travel or other exposure since then. So we have a small group, our small beta testing group that indicated we got all that data available, but indicated that the messaging to that group worked well in not bringing coronavirus in. It gets much more complex than that, because if we have a 7-day to 10-day turnaround time, it's pretty much meaningless. that they get the test done 7 days before they arrive here, and that doesn't tell us much. Testing of asymptomatic people almost never shows the infection. So that 3 days before people get symptoms of the infection, 3 days before people get symptoms of the infection, the current testing never picks up the disease. And then the question of we're then diverting all those resources, and if every university did this would be an incredible diversion of resources of all of those tests that are critically needed for healthcare. We can't even take care of our sick patients appropriately now because of the 7 to 10 day turnaround time that we have. So that adding that requirement in then also diverts all those resources away from the sick people who need it. I'm gonna rant for 20 seconds, which is we are the richest country in the world, and we have been unable as a country to just get our testing supplies together, and that is an amazing failure of this country to do that. All right, I'm done with my rant.
Thank you. I've got questions. Mr. Chief.
Two areas I'd like to ask about. How's this going to affect food service at the Rendezvous, the Student Union, and Turner?
So we are working, we have a vendor that we work with, called Chartwell's, and that vendor is utilizing primarily grab-and-go types of options.
Okay. What about Welcome Back Orange and Black? This community's been very welcome to the university every fall, and is that going to go away this year?
Well, I think, so we have reviewed new student orientation. Virtually all of that was going to be all kinds of activities over 4 days. And we are going to do most of that virtually online, which is the same as Boise State, Utah State, many of the other institutions. It's not ideal for creating new connections on campus. It's not ideal for welcoming and creating that warm campus environment, but that's what we feel is the appropriate thing to do. The week of welcome, we haven't reviewed yet, and I think Welcome Black, Orange, and Black is much like that. I think we should still promote Welcome Black, Orange, and Black. I think the community should be welcoming, but I think we welcome them in a collaborative, safe, engaging way as best as we possibly can. And like everybody has said, this is changing on an almost daily basis. And so where we are today and where we'll be on August 17th, I'm crossing my fingers we get to that. That's the beginning, and I'm considering it a finish line. You know what I mean? If we can get to the start of school, and how far we make it into the semester. I mean, I'm hopeful that all of the activities and all of the planning that we've been doing is going to keep the university open. But I also am realistic that we may be back where we were in March and April, unfortunately.
And the large group activities that occur downtown during Welcome Black, where you have 500, 1,000 people gathered together in a small square, would be very challenging.
Would not recommend that.
Just like Lava Hot Springs.
Yes, exactly.
There's a question.
Yeah, just at one point, I remember there seemed to be some buzz around in athletics around certain teams or certain states not being willing to send their teams to other states because they didn't believe, or other universities because they didn't believe that those locations were had appropriate safety measures in place. And is that still a conversation? And therefore, I think I've heard from Doug that anything that we can do on the community level to support limiting this is going to ultimately also support the school district and their efforts. And so I'm using athletics essentially as a very specific instance where if we as a community enact sensible mitigation plans, that we are going to be supporting not only all the students who come back, but very specifically perhaps the sports program at ISU, which is obviously very popular in the community.
Right. I think that makes a ton of sense. the meetings I've been in with the Big Sky Committee, they haven't said, well, if your community doesn't have a mask ordinance, we're not going to allow games to occur. They haven't said that yet. But they are talking about, non-conference games and eliminating those and trying, because I think the conferences then have a little bit more control over the requirements for return to play. I'm assuming that's a big part of what they're doing. I have no idea what's going to happen with sports. We know that some of the cases that have occurred on campus, even this summer, the only exposure that we can identify is a pickup soccer game that occurred, and this is the stuff that you've seen as you walked on campus. These are not university-sanctioned events. These are just people trying to recreate and have fun. And yet that is where we've seen some spread occur. My own kids play soccer within the school district. I've been very, very concerned. I was very concerned as they were playing competitive soccer over the course of the spring when that season started, and finally I pulled the plug. It was right around the time of the Highland incident. There were so many people that were connected to that, and we didn't have our testing results. We couldn't get testing results. How do we then, manage and mitigate that potential risk? So it is just so much is up in the air. But I do think that if we can say as a community, as a county, as a health district, our rates are remaining low, I think that's at least a greater likelihood that some of this stuff will come off.
Sure. I know it's all speculation.
Right.
Thank you.
And it's the same thing with the performing arts, right? And we've already heard much of the performing arts. Many things have already canceled. Even some of the Christmas stuff is already canceled.
Sure.
It's very, look at what's happened in New York City, exactly. So all of this is just really, really concerning, and obviously changes what students come to campus for, right? If you're a theater major or you're a music major, this has totally disrupted what your life dreams are about,
I'm going to make a statement and kind of see if I'm on the right track here. We can't manage the unknown unless we utilize the known, because masks are a known quantity and they help us to manage an aspect of the unknown. There are lots of other things, but masks are a known quantity. And what I have heard today is that the hospital can be affected if we don't manage the unknown. I've heard that businesses will be affected if we don't manage the unknown. I've heard that District 25, I've heard that ISU, and the biggest thing is we have to engage in decreasing the rate of infection. And now, is that a fair summary?
That's an excellent summary. Yeah, I totally agree. For our institution, one of the major employers in town, obviously a huge economic driver for the community. For us to have that population on campus, we've got to hold this thing back as long and as effectively as we possibly can. Otherwise, that contribution to the community just goes away.
Any other questions? Time is up.
Just say one other quick thing. I really do appreciate you asking us to be here and asking for the expertise of our physician community, our public health community. I think framing your decisions with the best evidence and the best information is extremely important. And I think you've heard that from a lot of smart people today. I'm not including myself.
I'm going to temper that with experienced people too, because smart only goes so far, but you have to have the experience that puts the edge on it.
Maggie's team has done an outstanding job. They've been great to work with, and they have just been, so collaborative and welcoming to all the other important entities in the community, and I'm sure you've experienced the same.
Yeah. So, yeah.
Can I just add one last comment? And I'm hearing this loud and clear from you, Rex, but I've also heard this from so many other people, and in all my conversations with Maggie in particular, she has emphasized, first and foremost, of course, is the safety of our public. But another thing to consider that is really impacted is the economy and our business community, and what can we do that can best allow that to, if not thrive, at least survive, or do the best that it can under the circumstances. And I just wanted to thank you for reminding us what an important participant and impact, ISU has. I mean, faculty, staff, students, all of them. But without that impact in our community, I mean, that would just be devastating to our economy. So what can we do to support that in the best way possible? And that's what I've heard today, and I'm hearing in all the conversations I'm having, that wearing masks will go a long way to saving our economy.
I think it was Goldman Sachs did an analysis that showed a 15% increase in mask wearing by the nation could contribute $1 trillion to the economy. And I think it's been mentioned today, but if 60% of the population wore masks, we could potentially push that R0 value that Maggie was talking about below 1, which means that we're not having an increase in spread within the community. It really pushes it down. Now, those are mathematical models, it's theoretical, but it's based upon the effectiveness and the importance and what we've already seen face coverings do in many communities.
That was another issue with the Sweden study, was not just that, as far as reducing the virus spread, that it was a failed experiment, but economically, the Swedish economist claimed it was a failed experiment. So we have to really look at that part of the equation too.
Okay, let me, Mayor.
If somebody else had a question, then they can go, but I have a couple I've written down. And I don't know, I've heard today about masks and how it's important for a mask, and I don't think anybody can argue or would argue right now the anti-mask campaign. I know we asked a few people to come that would have, or that have publicly claimed that a mask is not important and it doesn't work and all of that stuff, and they did not come to defend that or to make that argument for us. But that being said, we've heard a lot about masks, but I haven't heard anything about what we can do outside of wearing a mask that will help build an immune system to this. Is there? And maybe this is not the right forum that we would have heard that, but we had a room full of doctors and medical professionals and people that should know those things, that I didn't hear anything, and maybe I didn't ask the question, and that's why. Is there any way to help build an immune system to this, along with a mask? Say we wear a mask, but it continues on. How do we, is going outside help? Does that help? Does staying inside help?
No. So modifying our immune system, the only way to modify our immune system is to have a vaccine. Maybe diet, regular exercise, keeping ourselves healthy, all of that helps our immune systems be more functional and be more robust. But for this specific virus, the only immune system thing that's going to be highly effective is the vaccine. And I view the mask as the cluster of things. We have a standard cluster of 6. We send out with everyone. That's right. It's a mask, it's hand hygiene, it's physical distancing, it's staying home when you're sick, it's
covering coughs and sneezes.
So, and I think they've got it there as well.
Yeah, I was going to say, we see those here, but there's nothing, I have heard a little bit of stuff out there about, we don't hear anything, and maybe that's the answer, is there's just nothing.
So this is a virus.
There's nothing that helps prevent.
There's no silver bullet, but there's a lot of shotgun pellets.
There's these things, but there's going outside. I mean, does that help? Does the sun help?
As best we can tell, not. I think Arizona has proven that. But
That's a good point.
And they're in the incredible heat of summer. Being outside just disperses the particles so they don't get as intensely congregated, the aerosols, the droplets in the air. So being outside blows them away. There are some cool UV lamps that are available. They probably won't be in mass production for several months that you can put in classrooms and have running in the ceilings all the time that actively kill the virus in the air. Technology not yet available. Once it becomes available, they're going to sell like hotcakes.
Well, we'll have a virus by the time that happens.
No,
they won't.
Vaccine probably won't be for a year.
The vaccine, I mean, the vaccine.
Vaccine earliest is a year for a vaccine where we have enough production to actually cover people. And the other thing as well, other naturopaths, chiropractors, homeopathic people have herbal remedies that are purported to help the immune system, and some of those may actually work. There may actually be some immune system building with those. So if people want to take their own remedies, it's fine as well. But those are generic, and not really robust. And we have no medications.
And this is a virus that our collective, humanity's collective immune system has never seen before, right? It's not like influenza or other types of cold viruses that our collective immunity as humanity has grown up with and developed immunity to. This is different. And that's one reason that it's so devastating. And I think it's one reason we see such a broad kind of response to this virus. Some people, and especially younger individuals, seem to adapt and respond immunologically very quickly to it. Other people, it's been very, very devastating. And there's exceptions to even that. There are young people that have had very, very devastating complications too.
So I do have a couple more. So I'm thinking more about on an education piece. There isn't an education piece that says, look, if you really want to help yourself, go outside, get the vitamin D, get the, all of that stuff. Really, truly, is the education piece needs to focus on these 6 items that we know work. So then I have a question on. Well, Rick asked a question, lava, we got people shoulder to shoulder. Can we follow where people have been to lava and then they've come here? Because I don't believe it's necessarily the locals necessary that they're packing the parking lots, because the local's going to walk to the swimming pool. They're not going to drive there. So do we have a mechanism that tracks where these people were? I mean, do we know? How can we say lava is the problem?
The lava is the problem comes from contact tracing through the health department. So the health department calls up the case and says, tell me everything you've done in the week prior to getting sick. Everybody you've been in contact with. Every contact, every individual where you've been and where you've been. And it's through that they come to the conclusion that the only contact outside of their home was at Lava.
Was it Lava? Okay.
And the soccer team and the soccer game was the same thing.
And Butte County has no cases.
Yeah, recorded.
Yeah, recorded. What are they doing different than everywhere else? Is it just the lack of population? Is it the lack of testing?
Have you been to Arco?
Well, I have been. I have been.
That's it. They've got
the numbers.
But I'll be honest, Mayor, it's a little bit surprising because a lot of people pass through there, right? A lot of people are going to Chalice or going, to Craters of the Moon or over to Sun Valley or whatever.
Blaine County is next door.
It's right next door. And so, I can't say that there's anything we can identify other than the population density that just people haven't been affected. It is a little bit surprising to me. Even Island Park, I have a place in Island Park that we like to go and visit, and there's all kinds of people, sort of like the campgrounds you were referencing, people from all over the place, and all over the country, going through to go to Yellowstone, Grand Teton Park. So I think we're in a place where there is some significant risk because of travel through here, but I can't answer why some of these places haven't. I think it's population density is the biggest factor that I would say.
I think there's 2 or 3 counties right now in Idaho that don't have a recorded case.
And they're all small.
They're all small. And then another quick question, testing. We've obviously amped up testing quite a bit. I know that Mark said that we had plenty of testing at the hospitals and they've done everything that they can, but I also know that we weren't testing a lot of people up front, and we're testing a lot more now. I think the state's doing 12,000 to 15,000 tests a day now. Is that also part of the reason why we're seeing more numbers, or at least we know more numbers, or is it?
That actually gets, I've spent 3 or 4 hours looking at all of that, something called positive predictive value, and what the meaning of that is. And that's really, really hard to explain. It's really, really hard to explain. I still haven't come up with a simple way to do it. The testing we're doing now is 2/3 of it is people coming in with symptoms. So that was the same testing we were doing 8 weeks ago, was people with symptoms. So we are seeing an increase in the number of people coming in with symptoms, and an increasing proportion of those have the disease. So that tells us that there is more disease in the community. It's not just because of more testing. And that's a really opaque thing to get through. So, I still haven't come up with a good way of explaining it. So if we were testing people randomly, we're just going to take 500 people from Pocatello and test them, and 10 come back positive. Well, let's make it easy. We'll do 100 people from Pocatello and test them, and 10 come back positive. And then we say, next week we're going to randomly choose 200 people to test, and 20 come back positive. That's the only circumstance that testing is identifying is the cause of the increased number of cases. It is completely random, but we're not doing random testing.
So I'm trying to figure out the message, because the message is, and I think we can make the argument, there was a message before that if you wear a mask, your CTO levels are elevated and all of that. And I think that we can make that argument, but I also hear a number of people that are saying, well, we're testing more people, so obviously we're going to find more cases.
Isn't it percent?
Those cases were already there. We've had people that get them. I hear that, I had this back in November. I know I had COVID in November. And
so the raw number of cases could go up because of increased testing. But the percentage of positive, if we're testing the same type of people, it should stay the same if the disease isn't increasing in the community. And I think that's what Ron was just talking about.
10 of 100 or 20.
Right. If we test those 100 people and this week it's 12 and next week it's 15, then we know that we are actually seeing an increased rate of illness within the community. And I think that's what we can feel comfortable that we're seeing. In fact, Idaho is one of the highest in the nation right now in terms of the percentage of positive tests. So that even though we are doing more testing, yes, the percent that turns up positive is an indicator that there's increased illness in the community, not just the raw number of positives. The other thing is having these different metrics, Mayor, and that is what's happening in the hospital. How can we accommodate more people, being ill? What's happening with our ICU beds? What's happening with deaths, right? Just because we're testing doesn't mean more people should die. And yet, in fact, yesterday we had the highest death rate that we've had in the state of, the highest death day that we've had in the state of Idaho. I think 7 people died in the state.
From COVID.
From COVID.
That helps the message. Thank you. Yeah, that does help.
It is very confusing and very difficult, even, you know, for well-trained individuals to talk about the influence of testing. Testing itself is a science, and so it's difficult for people to understand, and even for trained healthcare professionals to explain very well the influence of how much disease is in a community and what that does to testing, because some of it is dependent upon how accurate and effective that testing is too, right? There's a bunch of factors that come into that, and I think it's beyond, unfortunately, beyond being able to have, you know, a press release around explaining it, because it is complicated.
So
Sorry.
We need to move ahead a little bit, though. Do you have a question?
Well, I think Maggie addressed this. I think she said that at one time we had a 2.7 infection rate with the test, and we're over 10% now.
15.9.
And we need to be at least 5% or lower to not have it being spread. So
yeah, that's what moved us into the yellow on the
that's
one
what I think
White House.
Yeah.
Okay,
Chris?
Yeah, two things that I sometimes hear is, well, the disease is not as bad as it used to be because the number of deaths is going down. And what I've read says, no, understandably, docs have gotten better at figuring out what to do when. So the fact that fewer people are dying doesn't mean we're out of the woods. And the other thing is, well, I've already had COVID, so I'm immune. And what I've read, or herd immunity, and what I've read about that is that now there's some indication that COVID immunity may last for a very limited period of time, maybe only as long as 3 months. Could you just briefly address those? Because I think those are legitimate questions that the public might have.
Yeah, go ahead. Your first one again.
Because the number of deaths are going down, either the disease isn't so virulent or we're kind of out of the woods.
So disease becomes less virulent because of mutations, and as best we can tell, all the data as of a month ago, I haven't read in the last month, is this virus is not mutating significantly. I think the death rate has gone down because the majority of people who are getting the virus now are under the age of 40. Because we're seeing the young people are the ones who predominantly are not following instructions and not wearing masks and not doing, the parties on the beach. So they're the ones getting the virus right now. When that virus spreads from the young people into the old people, the death rates are going to go back up.
Yeah.
I'm willing to make that prediction. I'm willing to make that guarantee.
I totally agree. And in fact, what happened in Seattle when the virus first landed there, unfortunately, it affected a lot of, a chain of nursing homes. And so it affected a very vulnerable population right off the bat. I would say, though, that our ICU admission rate has remained extremely constant over this time period, right about 1.5%. That's in some of that material there, and it's remained very consistent, which suggests to me that, yes, we're getting younger people that are being affected, but those that are affected are still at risk for an ICU admission at about the same rate.
In your second.
That I've already had COVID, so I'm immune, so...
We don't know. We haven't had enough people who've had COVID who get re-exposed to know whether or not they're going to get it. Tom Hanks will be one of the leading people. He was on the news the other day. So we don't have enough data to know.
I'll watch TMZ.
Mr. Chief.
What's the criteria for testing?
It's a bit of a moving target, unfortunately, because of
criteria.
Yeah.
We have had quite a number of people go through our testing center who are going up to Alaska for vacation. They're getting their testing done at the center to get so they can go on vacation. It varies from doctor to doctor and clinic to clinic and time to time. It varies based on, we now have 7 to 10-day turnaround times, and for people with limited supplies or limited resources, we're saying, it'd be great to do a test on you, but it's not going to change what we do. You need to stay in isolation for the next 10 days regardless of the test result. so that as test availability, when tests became widely available, we were testing anybody who had a sniffle or a sore throat. So that was about a month ago. We suddenly had enough tests available to test everybody we wanted. And so we were testing everybody with sniffles and sore throats. And now we're backing away from that because we have a 7 to 10 day turnaround time.
And limited testing chemicals, testing kits. Yeah, the reagents, exactly. So there are some places that are prioritizing use, and this has happened in the Treasure Valley, it's been in the news, prioritizing use of those tests to only those people with severe symptoms, because if people are young and relatively healthy with mild symptoms, it doesn't change what we do, right? We still recommend you go home, you isolate, you take care of yourself. If you get worse, these are the instructions to come in and be seen.
Is the test different for COVID versus the antibodies?
Correct.
Yes.
The COVID, the tests we're talking about for the virus itself are nasal swabs. Both the immediate one called point of care that we get results in 15 minutes, as well as the ones that are taking 7 to 10 days, they test for the presence of the virus. They're checking for the DNA specifically of the virus, presence of the virus currently. Antibodies are all blood tests. They tell us about exposure 3 weeks or more in the past.
And the body's response to the virus, right? We're measuring something the body has produced, an antibody to the infection. We're not measuring anything about the virus itself. We're measuring how the body responded to that virus.
So let me move from education to action in a sense, because it's almost 1 o'clock. It's been really informative, even for me. And I'm in the fortunate position of not having to make a decision. You're not. Everything I've heard today is doing nothing is really not an option for you as a city, not an option for us as a community. So I don't know how you will need to proceed, but what I've heard, a number of things. One is just some questions to throw out. One of the things we've talked a lot about is, does the city want to do a mask ordinance or not? I don't know if that's, that question is on the table. And you heard a lot of information about that today. Another question is, the health district has done a lot in terms of leading the charge on health issues. They have a draft plan. Does the city want to create your own plan? Do you want to build on the health department plan and then do somewhat like this? The school district has done, say, well, the health department will have their plan, and the school district then works on its operational plan of how to implement that in the schools. So I think that's a question to you as a group. I think what your operational plan will be. One of the things I saw today and heard is a lot of discussion about coordination among entities. So very fortunately today we had the university, the school district, the health department, the city. Kevin was here for a while. Structurally, if you want that to continue, how do you create a structure for the leadership to continue this discussion? Because obviously this is very fluid, and what we know today may be different than what we will know in 2 weeks. And if you want to coordinate and stay on the same page so we're not in different stages of yellow or red or orange or green, there has to be a structure to make that happen. So how you partner, how you structure that, I think is a question. I think managing the information and marketing, there was talk about the PIO's campaign about smart, safe, and open. I think this is complex and it's been politicized, but how to have consistent, solid information based on best science is going to be an ongoing challenge, and some folks will want to hear it, some folks not. When we were talking about how do you enforce, I was thinking, we worked hard at finally getting around to seatbelts. Now the way we enforce seatbelts is when the cops go to the accident scene and somebody didn't have a seatbelt on, then you know about it. There's always that unenforceability of some of these things. But what does having it generally do for most of the people? I don't think we'll ever have an enforcement mechanism. The thing about a seatbelt is I can drive my car without one and nobody's paying much attention to it. We're going to try to figure out how you do cell phone monitoring, and that's going to be a challenge. With masks, it's going to be really obvious. You're going to see whether you have one or not. That's going to be obvious, but how you enforce it is going to be a challenge. But I think some of it is just the messaging around it. But marketing information and how the city does that or how you partner with it is a question. How, if you want to partner with the school, with the university, with the county, how do you structurally set that up to happen? That may be different than what's going on now. If you want and need an operational plan and you want to look at what the health district is doing, do you build off of that? You can be more rigorous if you choose. You can't be less rigorous, as I understand it. So that's your choice. And whether you do a mask or not is your choice and what your structure is. It seems to me those are some critical questions to you. If you want to build a plan, probably that's some smaller group of folks needs to look at a plan and a template and what the pieces of that are and how that would fit with a bigger health district plan. But that seems to me, from what I've heard today, what's on the table. And I don't know, it's up to you all as a council and mayor how you want to proceed with that. That's not my challenge. My challenge was to help you at least listen and think and try to address what's critical, and I'm not sure what your next steps may be. So
I think there's another issue that's new, which is consistency within the community, because we now have some of our large retail chains who are essentially enacting their own requirements and saying, you know, you can't come into Walmart unless you have a mask. And so I think one of the challenges we have to think about and address is, do we have just this hodgepodge where who knows what is happening where, or is it important for clarity and for, I don't like the word enforcement, but for getting to where we want to get vis-a-vis masks? Is it important? And part of the education plan, really, or the communication plan, is community-wide consistency in our business community.
Yeah, you have right now, you have, is it Walmart and Kroger are saying, you know, if you want to shop in our stores, you have to go to Costco. So you still have some outliers.
Right.
Another piece for you to think about, because this issue has gotten somewhat politicized. I think Dr. Newhouse is right. The virus is not Democrat or Republican.
Or independent. It's very independent.
It's very independent. Which side we're in. But how you manage this, I mean, the reality is we will never have the perfect data to tell you exactly what to do. The data is going to change. But the challenge you have is how can you lead us through as a community in a way that unites us rather than divides us. Right now, we have more stuff that tries to divide us. So as you move forward, I think that's where coordination with other entities is critical, and is how you as a group work together to come up with what's best for our town, because the misinformation is a challenge. The fact that it is uncertain, and we like certainty, so we try to put certainty where it's not, is a challenge, and that's your challenge to go forward. So I don't know how far you want to go today or not, or what action steps you need to take in a group, or when you want to do it. I guess that gets back to you rather than me.
So as I'm listening to you, and it makes a lot of sense, I've heard a couple things that I think we might be able to do, or at least have a discussion on. I think it's extremely important for the community as a whole, City of Pocatello, Chubbuck, Bannock County. Now I can't speak for Chubbuck or Bannock County in any way, but for the City of Pocatello, I think it's important for us to be in step with the Southeast Idaho Public Health, in step with Idaho State University, and in step with the school district.
And the hospital.
And the hospitals. It sounds like they are, for the most part, kind of in agreement with this. And then they will build some things over and above that. And so I would make a recommendation to the council that maybe we consider this as step one, and we can say we can agree on some of these things. Now, it will take some coordination with the health district, because they will obviously be the lead organization that's saying, look, we have to move to this level or something. And so I think that I could see us doing this. I did hear something that makes a little bit of sense, because the face masks have been such a politicized thing in our community here, and it literally divided the community in half. That was last week. This week, just yesterday, the major retail corporate groups in the country have said, we're asking people to mask up going into businesses. We're asking all businesses to require masks. That takes it out of the political realm, in my opinion, and it puts it into, maybe we should be looking at requiring, in addition to this, asking or requiring businesses in Pocatello to require masks to come in there. It kind of takes it out of their hands, and I don't know, there's people that are arguing back and forth and fighting and stuff, but it kind of takes it out of their hands, and they can say, as Claudia's...
Well, and I want to thank you for bringing that up.
It's out of our hands, the council's done this, and so you need to have a mask, and that, just please have a mask. And that might be a first step that we can take that is not a huge political, and now if there's an issue that they can't put it on or something, then...
Well, but so to that, because I've been thinking about this since, well, especially since last week, and I don't want, I think that rather than ramming ourselves into the big boulder, which is saying everybody in this city needs to wear a mask at all times, which there are people who are just going to absolutely do this because we're telling them to do something and it should be their choice. But we've also heard from businesses who have asked that we do this because they want to stay open and they want to stay in business and they don't want their people getting sick and not being able to come to work. So if we help businesses by taking that burden ourselves and saying, okay, fine. It's like when, most of us in this room are parents, I used to tell my kids, I don't care what you tell your friends. I said you're not going there. Tell them I said you're not going. So that then they don't have to be uncool. Oh, my mom's so uncool. I don't mind being the uncool city council if we're helping our businesses. And then Major McCoy could speak to this, that then if it becomes an issue of someone trying to come inside to a business and is just adamant that I'm not wearing a mask, then that becomes not an issue of enforcing a mask ordinance, but now it's a trespassing or a public disturbance. Am I right there, Major?
So Major, before you go there, is there, though in my mind there would be a reason why somebody couldn't be. I've heard from our medical professionals
and that's true, but you know what?
There could be some people that can't.
But I hear you. But here we go. There are options. We have all the grocery stores, Fred Meyer, Walmart. Everybody has curbside, so you can order, you can pull in. You don't have to wear a mask. They'll load it into your car for you, and then you can pull into your garage and take your stuff in your house. So there's curbside. There's curbside for restaurants. There's curbside. So there are options for people. There are. And Amazon always delivers. So I'm just saying, there are options. dug in that they're not gonna. But at some point, businesses have to be able to protect their employees, because people not being able to go to work is not a good thing. And I'm a less government kind of girl. I hate the government telling me what to do. But this is a completely different situation than telling me I can't have more than 8 ounces of soda pop. This is a matter of public well-being. It's like the seat belts, it's like car seats. It's so I think that if we approach it with the businesses, that essentially gets us what we want anyway, because people, if they're gonna go into an enclosed area, they're gonna have to wear a mask.
So let me understand you clearly. You're saying the city should do a mask ordinance, or would the city do a recommendation to cities that you can require people to have a mask when you go in?
I don't want to use the word ordinance, because that's a trigger for people to lose their minds. But I would like for us to require that businesses require masks. And for enforcement, so the city of Whitefish just had their city council meeting 2 days ago. And they're very touristy, right? Because they're right outside of Glacier. And they've got thousands of tourists in that town all the time. And their city council just recently met to discuss this very issue. And a lot of the businesses in Whitefish were begging to be able to require masks of people, because they don't want to say it on their own, because they don't want to turn people away. But if they're required to do it, then they're like, well, I know it's stupid, but we have to comply. And so if we did that, then we're not only are we taking the pressure off, and we're making enforcement not about masks, but we're making enforcement about trespassing on private property or creating a public disturbance. Now, how would we enforce it with businesses is the one thing I've been trying to figure out, because, if clearly Walmart and Costco are doing it, but how would we enforce it? We don't have a business license program that we could say, if you don't comply, we'll suspend your business license, or something like it. We don't have any mechanism like that. Whitefish does, so that's what they're doing. But we don't have that. So all I can think of is if a business flat out refuses to put a sign on the window that says masks required, then, maybe that business gets fined. I don't know, or some sort of a penalty is imposed. I don't know. I don't know what that mechanism would be.
Quick, a couple questions here. Chris?
Did you ever get his reply?
What?
You asked him to make it.
What would?
Major?
Did you want me to speak?
Yeah, what would happen?
The mask ordinance itself, the way it's written, it's basically unenforceable, because all I have to do is say, I've got a breathing problem.
Right.
Problems for our officers are multiple. First one just off the top of my head is, I tell someone to stop, police, I didn't hear you. The next thing is, I do not want and will not allow my officers to get into a use of force situation over somebody wearing a mask. You want to make the national news, that's the quickest way you're going to do it. So us having a mandatory ordinance, you mentioned the seat belts, car seats, the cell phones. What we always have strived for in these types of laws is voluntary compliance. The problem is that this issue, in this year, being an election year, and with our country the way it is so divided that everybody has their own opinion, and nothing you say is going to sway certain people and their opinion. So having an ordinance making it mandatory for everyone in the city to wear a mask is going to totally disable our 911 system. It's going to totally flood our dispatch center, and our officers do not have the time and do not have the ability to respond to every citizen who gets on their cell phone and sees someone walking down the street and requests an officer to go check
I
on
think
them.
her question was very specific. If it is in a business, does it change from a mask ordinance to a trespass ordinance?
If it's a business owner, you require masks, and they're free to do that. And Costco has done it because everybody's addicted to Costco. Walmart's going to do it. They can afford to do that. But we don't have a licensing system, as you pointed out, for the businesses. So a mom and pop shop isn't going to want to upset their customers.
Or they want to get customers.
Or they want to get the customers. But the thing is that if I, as a business owner, ask you to leave my shop and you refuse to leave, that becomes trespassing. Okay? Yes, we can enforce that.
So it'd be like putting up a sign, just adding another word. No shirt, no shoes, no mask, no service.
Yeah, and the health department has been distributing those. So it's already out there. It's just a matter of leaving it to the business owners, allowing them a measure of freedom, or coming up with some way that you can enforce it through the business community. But if the ordinance is everybody in Pocatello will wear a mask, that will be unenforceable, and our officers will focus on education. And that's as far as we can take it.
Right, and I think that's kind of what part of the conclusion that we all came to as a council last week. And I think that everything you've said absolutely points to why making the requirement on the businesses a much better approach. Because first of all, there are far fewer businesses, regardless of whether we have any kind of business license. There are far fewer businesses or commercial enterprises in town than there are citizens. So we've immediately cut the population that we have to pay attention to in terms of getting the compliance that we would like. We've cut it dramatically from 56,000 to 1,000 or whatever. So I think that's a very good reason to come at it from the business perspective. I also think that by coming at it from the business perspective, we can also address our transient population, meaning our people who are stocking up at the grocery store before they go backpacking or whatever. They're tourists. Because if when they either grab the door handle of a business, there's a sign that says whatever version of please, you may not come in and shop unless you are wearing a mask. We offer curbside service, whatever. And if they don't see that sign, because we're all kind of immune to signage, then it supports the business owner to say, excuse me, ma'am, sir, you missed the sign on the door. We have curbside, we have masks, which is something else that I want to address later. But, and it supports the business owner. It allows them to be welcoming and compliant to their customer. And it does not put a business owner in a position of being the de facto mask police.
So let me ask sort of a procedural question here. I guess as the mayor, what's your process in terms of decision-making and legal authority to make which decisions when at this point? I mean, I hate to get into the weeds a little bit, but I mean, I don't know what the legal authority is around requiring a business to require a mask, which is sort of what I'm hearing. And then how do you do that? Is that an ordinance that the city, is it a resolution?
It takes an ordinance. I asked that question.
There's a structural process here.
It takes an ordinance to have something that.
So today, if best today, if you want, I don't know if you can take an action today.
Not that.
Pardon me?
We couldn't adopt an ordinance.
You can't do an ordinance today, but you could direct an ordinance to be developed, correct? That's about the best you could do on something.
So I think that we would like.
Where's our attorney?
We would like
Did he leave? Did he have a
I
meeting?
think, no, he's here.
Behind that mask.
It would take either an ordinance or a resolution, depending on what and
Takes
kind
an
of
ordinance if you got a request.
what you wanted to do with it and what.
Thank you. Jared Johnson, City Attorney, City of Pocatello. So for this meeting is to have a plan or discuss a plan and work towards that. So you're right. It wouldn't be appropriate to adopt an ordinance or a resolution at this meeting. Could we turn around and do it really quickly? Yeah, we could, for sure. A resolution would be a great thing to encourage, to strongly advise, to educate, but it would not have any teeth. There would be no penalties involved. It would not involve any actual enforcement whatsoever. An ordinance would, but then we would have to continue the discussion like you've been talking about as far as enforcement, violations, and exactly how that would work, especially when we talk about businesses. Some concerns there would be, how do you define what a business is? Which businesses are we talking about? Who would be the responsible party if the business doesn't do what the ordinance requires? So there would be a lot more discussion that we would have to have if we wanted to talk about that route. But those are some procedural steps.
And can I ask for some clarification? If we were to approach this from the business side, as you put it, I'm a little confused because I've heard people say, that takes the burden off of businesses and puts it on us where we're doing it for them kind of thing. But I've also heard some comments about making them do it. So I'm a little confused about what, if we were doing an ordinance or even a resolution, what exactly are we doing and what are we asking the businesses to do? Those to me are two slightly different things. And one does maybe take the burden off of businesses, but one maybe puts the burden more on them and singles them out in a way. So I want to be clear about what we're actually talking about.
Before we proceeded with any kind of further discussion about an ordinance for businesses, it would be important for us to hear from businesses because we have heard from some, but we certainly haven't heard from both sides of the.
I agree.
The argument on that. And there may very well be some unintended consequences as a result of that as well that we would need to consider. And I believe that even if we did have an ordinance for businesses, there would still be businesses who chose not to. And so it's going to be an issue.
And I agree. And so what I first of all, I don't like the idea of ordinance. I really don't.
Agreed.
But if we did a resolution, if we did a resolution where we are urging, begging, pick a word, businesses to imploring businesses to require masks in their business, then they still do have the freedom, and because we don't have a mechanism to enforce that, because we don't have a licensing thing, but we're still sending the same message. And I'm glad you guys are still here. I was going to turn around and go, and according to our health professionals and the other people who were in the room earlier, if we could get 60% of the people to do it 60% of the time, then we would reduce our rate. So if only 60% of the businesses voluntarily put the sign up that said masks required, then I would consider that a success and a definite step in the right direction. And then I think that the rest of our plan would be, we would take the rest of our cues of what the feds and the district, the health district sets. But just in getting a few more people to wear masks in enclosed places, I think is my goal. That's my only goal. And I think a resolution alleviates the enforcement issue, still gives the businesses the freedom to make the choice. But like I said, if 60% of the ones that are not requiring it now require it, then as a community, we win because the transmission rate will go down.
If you're going to do if we are going to do a resolution instead of an ordinance, then my question would be, why would that resolution then only be focused on businesses?
Because we have to have some sort of focus and approach. And we've already seen from last week that telling people...
But I'm saying you're not doing an ordinance, we're doing a resolution, so why wouldn't the resolution then just be citywide?
Encourage all to read.
Because I think that the minute you say everybody, I just think that the minute you say everybody, you're gonna get pushback.
I think we need a strongly worded resolution by our legal department that supports the plan that's been proposed right here and puts some emphasis on not just citizens but business. I think you're right there, and I think that can be one of the dozen or so whereases Jared might come up with. But the plan's here.
Right.
Why should we reinvent the wheel? It's here.
I agree, and these are the professionals. These are the people who are trained and experienced to give us guidance.
And it has the
that we can supplement.
And it has steps, and it's all defined. It's right here.
I just think that
or this is their menu, and when they say, when the health district, once whatever the final version of this is adopted, says you will do this.
Well, then we have
that's
no choice.
what we have to do. Here's my only concern. When we think about inflicting damage on our community, we can think about that from the health perspective and say, okay, not very many people are dying or becoming incredibly ill, so as long as that's not happening, we're fine. However, the Goldman Sachs article that was referred to earlier, and also a recent Forbes article, has looked at why isn't the economy recovering the way we would expect it to in places where their infection rate appears to be going down. And so far, the conclusion is that it is because many people are simply not going into public, and they're not shopping, they're not staying in hotels, they're not doing those kinds of public activities. And therefore, we have a restricted amount of money flowing into the economy. And so as I think about our business owners and their families, our workers and their families, I think part of what we have to do is create a context where people, larger numbers of people, feel more comfortable going to the grocery store, not every 2.5 weeks when they're down to there's nothing left. But they're doing what I have cut my grocery store visits dramatically. I don't just run in for something. So, and if we are not supporting the most open, robust economy that we possibly can, we are also inflicting pain and suffering on families as their income is cut, as they can't pay their rent, as they fall behind on their mortgage. So I think we have to think not only about mitigating the illness perspective, but I also think we have to think about what we can do to support and mitigate the economic damage that this is doing.
I feel like we should do a resolution.
Revelation?
Spoken like a preacher.
A revelatory resolution.
If I were one of those eschatological persons, I could get into a lot of brimstone fires. We could scare it. But I really think we need to do a resolution, but one of the whereases needs to be that we have the wherewithal to do an ordinance. We can say, as a prelude to doing an ordinance, we are strongly encouraging people to do this as a prelude to the health district, because we are the epicenter for our county as a commercial entity. And even though Lava is a collection point for a number of people, this city is a greater collection point for far more people. They go into yards. I've seen it in some of the places where you got 3 or 4 neighbors coming together for just sitting out at night, but they're not social distancing. I think that what we have heard today is that masks are an essential component of a broad-based plan. I think the discussion about the various components of the plan is something that has to be ongoing. I think the health district's got several of them. I also think one of the things we ought to be talking about is a long view where we look at our wastewater treatment and see a way in which we can converge and coordinate. But that's down the road. Right now, I think we need to convey the urgency of wearing masks. We can write the whereases to why it is an important component. All the stuff we've heard today, it's an important component for our economic freedom. It's an important component for our healthcare freedom. It's an important component for our student freedom. It's an important component for our ability to move among each other. All these freedoms are at stake if we do not do a strong stand here about what masks can contribute. Because social distancing hasn't worked. The suggestion of masks hasn't worked. We need to come out stronger. We need to have some backbone behind it to say the health district is saying if we don't do it, they can do it. And the health district has told us that if they're not ready to do it right at that point, we still have the capacity ourselves to do it. And I think we can just write this resolution in a way that it's a strong resolution that is an indicator of we got to get with the show, because if we don't stand up to the virus, it will run over us.
Okay, I'm going to take a crack at it. Are you ready, Ruth?
Okay.
Okay, this is a proposed guidance motion. I move that we instruct staff to prepare a resolution encouraging the community to review the plan prepared by Southeast Idaho Public Health and to consider the recommendations of Southeast Idaho Public Health. We can, wordsmith that. The staff can wordsmith that, but
Okay, so
everyone in the community should review this plan and
When it's all over,
consider the things that the health department is telling us.
But you're not saying anything about us adopting it?
Well, I don't know why we need to recreate the real
Let's vote on that before we get four piled up again.
Clarifying what we're talking about.
So we have a motion now by President Adamson and a second by Cheatham, and now we have a question.
Yeah, I'm a little confused, I guess. We're asking the public to look at it and consider it? I thought we were considering whether this is the plan we're implementing or we're going to tailor or...
Well, correct me if I'm wrong, but the health department has the authority to mandate this to us, right?
They do. I thought the motion was, and this is how I interpreted what Heidi said, was that we would adopt and follow, adopt might be the wrong terminology, but follow the recommendations of Southeast Idaho Public Health in their plan.
And that's what I'm not hearing in that motion. That's what I'm asking.
Yeah, I didn't necessarily include that. I don't know why we
will.
need to do a plan on top of their plan if it's the same plan.
We're approving something today that hasn't been approved at that level.
They have a draft plan at this point.
But I'm confused about what we're asking. We're just asking the public to read it and maybe do it? Or
That's it.
is that it?
That's what,
It's voted.
that's what the motion is.
Vote it.
Okay, so we have a motion by Adamson and a second by Cheatham. Ruth, could you please call the roll?
Adamson?
Yes.
Cheatham?
Yes.
Gray?
No.
Lurick?
No.
Ortega?
No.
Stevens?
No.
Okay, I have a counter.
Okay, you have a
I have a
motion?
counter.
I move that we develop a resolution that demonstrates the urgency of needing to wear masks, and that resolution include the action plan of the Southeastern Idaho Health District when it's approved, and that we also indicate we have the power to mandate masks if the indicators say that we should.
Will you enter?
Can I add?
Yeah.
An amendment?
Sure. Well,
What?
tell me what it is.
Okay, well, I'm just reading from this. So my thought would be that the resolution could be based on the fact that we are currently, and this is the county, not Pocatello, but currently in the green zone. And the resolution therefore says,
We can write that in the resolution.
right, but it basically is based on these bullet points, and it says, in order to avoid moving to the yellow zone, which would require, and we'd have to agree on this, but we would require, at which point the city council would enact an ordinance. We want people to stay home if they're sick, maintain, blah, 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 everything that's in the green zone. Because then what it says is, here's where we are based on current information, which could change next week. Here's what the health district has already recommended, which is basically also what ISU is doing, and the school district and the hospital and everybody else. And if this doesn't work, then council reserves, the right to move to an ordinance.
Yeah. But
Now,
I think we can put that in.
A big mess in terms of what's the
I
motion.
think the resolution itself has to be drafted. I don't think we need all the wording for the resolution, but I do want to make sure that we indicate urgency and that we show that we can, if people are not responsive to the resolution, then other means have to be gone to.
Why would we adopt a resolution that includes an ordinance we've already been told we can't enforce?
Because
I'm not saying that's the ordinance.
Well, but you're threatening them with an ordinance.
But we don't.
that's the
In that
truth.
resolution,
But wait,
an ordinance we can't
have to.
enforce.
But wait, we don't have to do that. We don't have to pass an ordinance. Because if our resolution is one that really strongly urges businesses to require masks, then if we get out of the green, SIF will tell us mandatory face coverings, and then we have no choice. Then the people of this town will have zero choice. But so we don't have to say we can pass an ordinance, because we won't have to pass an ordinance. SIF will make us do it.
We don't know that.
That's right.
Well, it says it right here.
This is their menu.
So I have a motion on the floor, but I have not had a second yet.
Second.
I don't even.
I don't know what
I don't
the
even
motion
understand
is.
I don't even know what the motion is at this
Well,
point.
you just seconded something, you don't know what it is.
Well,
Slow down. So why don't you try to rephrase? Do you have?
I'm going to have to listen to it too.
I move that we create a resolution that demonstrates the urgency of wearing face masks. And it's not businesses, it's face masks. And that we implore our people to understand through this resolution all the negative effects that can come if we don't. We've heard them all today. I can go that summary. And that we suggest in the resolution that we are doing this to stave off exercising our right to make a mandate.
More stringent restriction.
More stringent restriction. This is our overture to everybody.
Can I ask maybe for one addition to that you emphasize, I mean, all people, you strongly urge all people to wear masks, but also encourage businesses.
Yeah.
Just that we do both.
Yeah, and we encourage all people, wherever they go.
And all businesses, yeah.
All businesses, yeah.
Okay.
I feel like we could go back and forth with a whole bunch of different motions until we all got our preferred wording in it. And I'm wondering, I'm just throwing this out there, if it would be better for us to just maybe get a recommendation from our legal department on how we could appropriately phrase it, because I guess I have some concerns about making it specifically about masks. That's kind of a hot
And we should say face
item,
coverings.
and we need to encourage people to practice all healthy habits. It's not just masks. We want people to be smart and do all the healthy habits, and that's why I was trying to propose that they review all of the information from the health department, not just the mask thing.
So I have a motion.
No second.
No second.
No, she seconded.
Chris second.
I seconded one, he restated it, so I will second it. And then in terms of discussion, I believe I heard clearly, in no uncertain terms, from our school district, from our hospital, from our university, major employer, and we're hearing secondhand from from several of our major shopping outlets in town that specifically masks are the best tool that we have now in terms of mitigation. And I wonder about the fact that our school district has had the courage to take a stand, our university has had the courage to take a stand, our hospital has had the courage to take a stand, Costco has had the courage to take a stand, Walmart has had courage, Kroger is on board, and probably if we had more big box stores in town, probably.
I think Kroger, I'm not sure, is it Smith and...
So I guess the question I throw out to all of us is, if these other community entities and corporations that are in our community have had the courage to embrace the best science we have right now, which says wear a mask/face covering, why is it that we, the city council, what is the barrier that we have that they didn't have, because maybe there is one, and if there isn't a barrier that we have that they have and surmounted, then why can't we? Because ISU controls their campus, and their whomever, provost, whomever, whatever their administrative structure is, essentially performs the same role as the city council does for the city. And the school board performs the same function for the school district as we do for the city. And so and the hospital board. So if these other entities have been able to take a stand based on the best information we have, why is it that we cannot match their courage?
It's enforcement.
But
I think our situation is different than all of those. They are all only controlling one aspect of the community, whereas ours is about the whole community. And I don't see this, I personally don't question the science at all. I find the science convincing, compelling. To me, that's not the issue here. The issue is, and whether it's an ordinance or a resolution, but particularly with an ordinance, are we going to enact something that it needs to be, but if it needs to be a solution to an immediate problem. I mean, this is an emergency situation, basically, right? So this is a temporary ordinance, basically, to address an emergency situation. So let me just make my point. If it's not going to be followed, or people aren't, if people out there are going to just say, nope, I'm not going to do it, you can't make me do it, and we're running around trying to enforce something that we have very little chance of enforcing, and we're wasting a lot of time and resources on trying to do that, it makes that ordinance become basically useless because it's not addressing
we're not talking about
the problem.
I thought we were talking about
We're talking about a resolution.
Where I'm going with this is you asked what the difference is for us, and those are all things we have to consider, is the impact of whatever we do on the community. And I'm in favor of doing something, but the answer to your question is there is a difference for us, because what we decide has, as we saw last week, had a huge impact on our community, and we saw overwhelming response. People, as you put it yourself, entrenched on both sides. They're not going to listen to the other side. So we have to look at whatever we can do that will be the most effective at addressing the problem in the, not just short run, the immediate run. So that's, to me, the difference here is we don't have the luxury of like waiting for people to come around, or, and we also don't only address, one hospital or one business or one store. It's the whole community, and we have to get them on board with that as much as we can so that it will be successful. That, to me, is a different situation than what ISU or the school district or anybody else is dealing with.
So I think that's the answer to the question.
Well,
we're not talking about an ordinance, though. I just want to be clear. We're talking about a resolution.
And
however, the question was asked, and I think the answer was given. So,
and whatever solution we're talking about has to be effective.
Sure.
And let me speak to this for a second. The resolution gives us a lot of latitude and longitude. I've only asked for a couple things to be specifically included. It does not exclude anything that anybody has brought up here. It does not exclude the health plan. I expect that to be part of the record out of which this came. I think the record will also demonstrate the unanimity of all the care people that have testified to us today, of how important it is to be ahead of the pandemic if we can, and masks are an important component of that. And we've got a record here of a lot of testimony. I hope we will draw on that in drafting the resolution. I don't think we need to get into enforcement at all, because that's not what the resolution requires. It just is that we are imploring our people, do what you can to help as many people as you can to help us stave off this spreading in our community.
But if the wording, is that the wording, that open-ended wording is what you're suggesting is the basis for the resolution?
I'm saying that it gives us a lot of room there. The only two things I put in my motion were that we do demonstrate urgency and that we show that we have another thing that can fall if this doesn't work.
So we no longer have any reference to this.
I think,
It's implicit.
just to make a clarification, it sounds to me like until you see the written resolution, you don't know what's going to be in it. That's what I'm hearing.
Yeah,
And I
it's
think-
implicit.
I think all of these 6 items could be in it. I think what you need is a resolution drafted. If you accept the motion, you need a resolution drafted that's got elements in it that you can look at and amend or change. But right now, it's, you don't have that, so there's a lot of what ifs at this point. So you have a resolution that has 2 major points with a lot that is left unsaid that still needs to be fleshed out. I guess whoever has to do all that work can do it, and then you've got something to look at. At this point, you're not voting on passing a resolution, you're voting on getting a resolution
Creating a
drafted.
resolution.
That's what I hear.
And I'm assuming that it's going to be basically based on what this plan looks like and stuff. That's where you're going to get some of it.
Yeah, that's where a lot of your whereases will come out of there. Whereas the Hill District has got the 6 primary things, and mass are a major component of that.
So then we would get a draft.
You would get a draft.
And we would then, debate the points of that draft and whether we agree with them or want something added or removed or
Yeah.
That's how
how.
Can we have a time frame, please?
Well,
As part of the motion?
There was no time frame, but I was going to ask staff, lack of a time frame, just to have it prepared for our next council meeting, which
Yeah, I
would be
think by
the
August
6th,
6th.
August 6th.
Okay, but by then the health district will have,
They will have had a plan, I would assume. They will.
Maggie said by the last week of July. So if we're not going to do anything until August, then
that becomes a formal plan rather than a draft. And whatever they have is what we can reference. That was one of my points, is that this is only a draft. We don't know what it's going to be.
Right.
So when we do the voting on our resolution, we will know what it is.
Right.
Okay, so we have a motion by Brian, a second by Stevens.
Heather, question?
Another question?
I'm not comfortable with our resolution having any kind of a statement that is perceived by people as a threat. So
how do we include this in it then if it's not a threat?
It's a plan.
well, no, and I'm not saying we can't include this in it, but the part of your motion where you said, and we make sure people know that we can come down with an ordinance if we need to, that's the part that I'm not comfortable with, that language.
Yeah, I would be more inclined to have it say more along the vein of if we want to avoid.
So let's do this. We have a motion. Let's vote on it. If it fails, then somebody else can have another.
I am open to a friendly amendment that we talk about avoiding the exercise of the health plan, which would require.
So do you have a friendly motion amendment?
What I didn't hear is avoiding it as much as you can put a positive spin on your whereases to support the minimal risk. If we do this together, then more stringent things would not have to occur by either.
Heidi has a friendly amendment, it sounds like, that see if he's amenable to.
I don't know if it's an amendment or a comment, but why can't we just ask the staff to come back with their recommendation to us? Because they've heard everything that we've said, they know what various council members feel strongly about, and rather than us trying to dictate in our motion specific things, if we are intending to have it as a draft that we can then give feedback on, why do we need to get so hung up on the details in our motion? Can't we just instruct them to?
I want the word urgency because we kicked the can down the road. We kicked it down the road last week. We're kicking it down the road for 2 more weeks, 3 more weeks.
So there's 2 different things. So urgency is not the threat that has been concerned about.
But I think we can talk about how we are trying to prevent anyone having to exercise the requirement.
Exercise moving into stage yellow.
Prevent the exercise of a mandatory mask requirement.
Yeah.
Okay? I'm fine with
And I
that.
guess I'm not really comfortable with the idea of just leaving it so open and saying have staff come back and recommend to us. I think it's our job to say, really, I mean, they'll write the draft and we will debate the points of it and the details, but I think it's our job to say basically what we want in it or not in it, or the kind of tone we want to set with it. I think we have to do that, and not just say, well, have them bring us something. I think we need to make that decision.
And I guess that was my concern, is I felt like the motion that's on the floor is a little more,
The language is a little more threatening.
yes.
So,
And I would prefer a gentler approach in the hopes that we get more buy-in from the community.
So what about if we, instead of trying to wordsmith, what if we just had, we identified kind of like what are the bullet points, which could then give staff some direction as to what the whereases might say. So what can we collectively agree on would be important to have in the content of the resolution so that staff has some direction?
Reference this.
So let me throw something out for you. Okay. What I've heard today is, A, there is in front of us a serious health risk to our community, a health and economic risk to our community that requires action on everyone's part. Number two, there are 5 or 6 actions under this thing that if everyone takes, individuals, businesses, etc., we can mitigate our risk to our health and our economy. The more we do that, the better. In that, wearing masks is a very important component. And if we can do those things, working in partnership with the health department, the school district, the university, and the county, we can minimize the risk to our community, and we can enhance the recovery from this pandemic.
I would suggest that there's one more.
There may be one.
And that would be the testimony from the hospital that said that they're close to capacity, and we have to manage the occurrence of the spread of this so that the hospital continues to be a resource that we can count on.
Yeah, fill that in. Anyway, put that in a bucket as whereases. So there's a strong encouragement to the community. And that you've got some other whereases you could put in there about some of the economic impacts of doing it right. And that you don't have to get too heavy-handed, because in a way, like you talked about the parent being the bad guy, the health department may be the bad guy for you.
Right.
But at this point, if you don't think you can get that far, you can at least with this motion get a strong statement that we all need to move in a certain direction.
I think it might be important, for example, to say, whereas Idaho State University has yada, yada, yada,
school district,
whereas, the school SD 25, because I think part of what we need to communicate, first, I think 2 things. Number one, I personally, as a council member, believe that I need to support the other significant entities in our community. We heard a lot about partnership and collaboration. I believe that that is an important duty of the council. And I also believe it will help with the education piece and the convincing piece, because if people, different messages for different people, and for some person, the fact that ISU believes this is important may be the switch that turns their light on. For somebody else, it might be whereas the hospital, blah, 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 or whereas the health district, or whereas the school district. I think that would be specific content like that would be important.
So I would recommend right now, in fact, we're going to do it, I'm not going to recommend it. We have a motion on the floor. I believe we understand what the motion is. We have a capable attorney that can put these whereases together. We don't have to wordsmith it and all of that stuff. I'm going to call for the vote. And so we have a motion by Bray, a second by Stevens. Ruth, could you please call the roll?
Okay, could we have Ray restate the motion?
Just a minute, Ruth. Could you restate the motion? It's that confusing.
I know, that's why
Okay.
I don't even know.
That's the problem with all the conversation and guessing.
Somewhat convoluted, but it appears, council, that you would, and with addition with Mr. Weeks' comments, that Mr. Bray, you want to make sure the word urgency is in the resolution to prevent the city of Pocatello going into the red stage. I also...
From advancing beyond the green.
Well, yes, advancing from, yeah. Well, I don't have that in front of me, so I don't have any idea.
I trust Jared
to prevent moving past the green stage then. Okay? I haven't seen what you have in front of me.
I understand.
And then you'll...
And then I also have Mayor and Council to move to create a draft resolution to use face masks, educate population about face coverings, doing the resolution to stave off more stringent restrictions is what you originally had. But Councilmember Adamson didn't feel comfortable with that, so that's when Mr. Week offered his addition to talk more about the medical issues, to have people participate. And we also wanted to have a resolution on the August 6th meeting to give staff time to put one together. You will look at that resolution at that time. This isn't the whole motion, but I'm just making sure I can get in the minutes what I just heard.
The nature of our discussion.
And then Councilmember Stevens would also like wording about ISU and the school district in the whereases. But it basically came back to be an education piece that legal staff will prepare it for August 6th. They're going to need that time, I'm sure, to even prepare one unless council wants to have another special city council meeting to look at that. That is the only other way to look at it prior to August the 6th. So does council feel comfortable with that in the minutes? And I can work with Jared, the city attorney, regarding the actual motion. Do you feel comfortable with that as to what you're getting ready to vote for? Yes.
How about we just, I will withdraw, make it simple.
Okay.
That we create a resolution.
Is this a substitute motion?
Yeah, he's withdrawn his original one, so it's been withdrawn.
Okay.
Okay.
That we create a resolution communicating the urgency of using masks as part of the components listed in the Southeastern Idaho plan. And that we empower our attorney to draft that resolution based on the conversation we have had about what should be included in it.
Second.
Okay.
Call the roll Sorry.
Okay, so I'm just wanting to make sure.
Second.
I'm still a little uncomfortable with it being like all about the mask. I think we need to encourage people to do everything that the health department recommends and not make it
Well, he just
the
said
hot-
one component, that the masks were just one component of
Okay.
all these 6 points.
But I'm just saying in the phrasing of the resolution, I don't want it to become
It's
the
a motion ignored component.
I want to understand and make sure I know the intent. The intent really is to include Southeast Idaho Health's,
But
it's a draft now.
emphasize that face coverings are essential components of what they have outlined.
Yes.
It's a
Okay, does that answer your question?
So,
well, kind of.
So what if we
So what?
said something like, we empower our staff, city attorney, whomever, to draft a resolution that conveys the urgent need for individuals and businesses to follow the Southeast Idaho Health District COVID mitigation measures as follows, green bullet points.
I'm a lot more comfortable with that because it's not.
Because it says right in here that masks.
Yeah, I know, but I think I alluded to that. I wanted to emphasize.
Well, I'm just, yeah, I was just in my own head trying to understand exactly.
So is that a substitute motion that you're offering there?
Yes.
And I would second that substitute motion.
So we have a substitute motion by Stevens and a second by Adamson. Any other discussion?
But that doesn't include all the other discussion we had. That motion.
Well, it kind of does because she said that our staff will include things that we've discussed.
I think your discussion included in the whereases, the coordination with other entities, the critical importance of the mask is one of those 6 elements. The impact on the physical and economic health of the community, those items could all be in the whereases. I think if you put that together with what you just said, then you've got something to start with to look at in terms of a document.
I'll withdraw then, if that's more comfortable.
So does that?
Okay.
I think that's what I've heard.
That's what I'm hearing.
Okay. So we've got the substitute motion, the original motion has been withdrawn, and so the
primary motion.
The primary motion has been withdrawn. For the substitute motion, we have a motion by Stevens and a second by Adamson. Ruth, could you please call the roll?
Yes, sir. Stevens?
Yes.
Adamson?
Yes.
Gray?
Yes.
Cheatham?
Yes.
Lurick?
Yes.
Ortega?
Yes.
Okay, thank you. It was a long time to get through that one motion. But I think we got it, and I think we're in a good position there. And I will make sure, Ruth, I'll make sure you have this. I gave one of these to our attorney, so I'll make sure that Ruth has one so she knows what we're...
Mayor, before we adjourn, I got a question.
Yes.
We voted to apply for the COVID recovery funds that are at the state level.
Yes.
We weren't listed in anything as having applied.
That deadline is tomorrow, and we will be applying.
Okay, so we're waiting till the last minute.
No, we're getting solid numbers and making sure we have the right numbers when we do it, and so no, that will be done and taken care of.
Since I think you'll know before we do, could you just keep us apprised on how, what the timeline is relative to SIP?
Yes. As soon as in fact, I'll send her a text right here this afternoon and ask her as soon as this is adopted to let me know, and I will send a text out to the council to let you know that has been adopted, and I'll have her send an email with that final adoption.
Great.
And Mayor, on that point, if I may, so the motion the way it was, not to go back into that, but just to let you know, relies on the plan being adopted by by the south end.
Well,
You have, I think you have some guidelines here.
Right, absolutely, could use the draft language. I just wanted to make sure, if for some reason by August 6th, they don't have a plan actually adopted, that might change the wording of the resolution.
Well, then we could just say in the draft plan, as follows.
I just wanted you to be aware.
Ruth, does that make sense to you? Do you understand what I'm saying?
I would just want to recommend to you a couple things before you adjourn. I still think you need to figure out what your process is going to be, your structure to stay coordinated with the other partners. You still need to take care of that. Assuming that this goes through, the district goes through, you still may need to look at how you will operationalize it at the city level. You can't let those things go. And marketing is going to be critical because the information flow is in flux, and you're going to need to figure out how best to communicate consistently and constructively through this whole process. I think the fact that you got a 6-0 vote on this resolution is a good statement to the community, and I would congratulate you on doing that. I would say in the old days, I would say this is necessary, but it's not sufficient. And so you've done a good start, but the job ain't done.
So, go ahead. Oh, I was just going to say, so speaking to that then, should we decide amongst us that one of us is going to be the point person with communicating with SIF and Bingham and Portneuf and everybody else?
Yeah, I mean, do we need to,
or is it,
how do we do
because if
that?
not, it's going to be very disjointed, or
You need a structure.
we need some sort of
I think
pyramid or
that
something.
you've got, the mayor is on that call weekly that they have that coordinates that. The school district and the university and stuff are not, and there's not a mechanism that pulls the school district and the university and SIF. That was, today was the first time all of the county, Chubbuck and the county left early, the school district 25 and the university were together. And so I think that what it is ends up being a meeting that we call to see where everything is in the next few weeks and see if we can invite the same people.
I wonder, Maggie, near the beginning of her presentation, talked about, and I can't remember the exact language, but how Chief Gates had basically helped put together, what was that term?
There was an incident command team.
Incident command team. So I'm wondering if maybe we couldn't, utilize the experience and expertise of our fire chief and basically have, our own version of an incident command team, which would be, the players who were represented here today. And the chief obviously has experience. And so rather than us sitting around and trying to, reinvent the wheel, maybe that would be a model we could use.
Well, she mentioned that all 8 counties are involved, all the regional hospitals, the first responders, the United Way, ISU. So it would just be a matter of...
But I don't know that we need all of them. I think this might be a different, a different smaller subset.
If you want to do it, you would at least need a group that includes the city of Pocatello, the school district, the university.
Chubbuck.
You invite Chubbuck, you invite the county. Those are at least, those 5 entities at a leadership level has to have some, whether you do it weekly or bi-weekly, buy-in some way.
And perhaps chamber.
Yeah, chamber
would be good.
And I would say we should start thinking about including the reservation.
You could start to look at Fort Hall or whether or not the Marsh Valley School District needs to be involved, but somehow, some way that the leadership of those entities stays connected in terms of how this moves so that you don't go from, as the health department decides on what their plan is going to be and how they implement it, that you have a formal mechanism to make sure that is transmitted unilaterally and it doesn't depend upon the luck of the draw of who's going to make the phone call when. So structurally, I think you need to figure out, maybe that falls on his shoulders to do, but I think structurally, if you want, you're going to need to have a mechanism to keep those key players talking to each other. Now, the incident command structure gets into the weeds and the nitty-gritty, but I think you need a leadership structure to keep moving together.
And one of the things we're going to have to ferret out is if we're creating something that's already created in the unified command, because all those entities are players with the.
If they're there, then you don't need it. But if they're not the right level of player is not there, then you need something.
So we got to just see.
You got to do some homework.
We got to see if the county, their structure moves at such a county level that it precludes the nuance of the city level.
And Commissioner Moser told me the county's planning to do nothing at this time. Now, whether that's not obviously an official declaration, but I said, where's the county on this? And he said, we're not doing anything right now because, they're going to just do whatever.
So what that tells me is it's even more important for you to have that group. And maybe you have in that group a commissioner, the superintendent. I would ask Rex who the best person from ISU would be. Maybe it's the president, maybe it's not. But an ISU representation.
Well, I think the two people that were here from this perspective were very key.
Would probably be the best. I wouldn't disagree with that. But I would ask him, probably the mayor, and then it would be your responsibility to kind of make me sure that I'm giving you reports on that when we meet. But you got 1, 2, 3, 4, 5. Who else did you say? Oh, the mayor of Chubbuck. The chamber.
You should extend an invitation to Fort Hall.
I will extend another invitation to Fort Hall.
I think we need to do something about the Idaho State Foundation runs that swimming pool. That's a hot spot. There had to be 1,000 people in that pool Sunday afternoon.
Yeah, Leva.
Perhaps the paper could write an article.
There he is, but he had his hands over his ears. Every time I hear laughing, he does this.
All right.
Why don't I do that, and then I'll report to the council what that structure looks like so that we can...
Right, and then if we could get whatever minutes come out of those meetings, because I think one of the things I heard was throughout today was that we need to have some kind of a consistent message, that we're going to be working against each other if this entity says this and this says this. I mean, it basically will dilute or maybe completely destroy the credibility of all of us, because then we're feeding right into the idea that there are 18 different opinions about how things should be done and what it's important to do, and I think it will
just stay. Okay.
And so this is not, it is related, but so you're going to have a draft for us for the 6th of August. Is that a study session or what is that?
It's a council meeting.
And so then we're going to vote on that night?
Yeah.
I'm just trying to figure out, because the doctors, both Dr. Snell and Dr. Newhouse, are very, very concerned about doing what we can now in advance of the regular flu season. Because we have to keep in mind that people are continuing to get sick. People still have cancer, people still have COPD, people still have complications from diabetes, people have all of these regular diseases that are not COVID related that are taking up bed space. And then you add regular flu season. So I just want to make sure that we're not talking about this in mid-September, because they were both very clear, this needs to be addressed.
I think
July or August, they were saying.
That was a suggested component of the resolution.
The urgency.
the urgency.
I know, but I'm just talking about us, because I know how we operate. So I know we can talk about things and say, okay, we'll come back and we'll talk about it next week. And I just want to make sure that we are all on the same page, that we're going to take some action.
If Jared drafts a resolution and we edit it, can we pass it without it being republished?
We don't publish resolutions.
Well, but we...
You edit that night, you mean?
Yeah.
You could have that deliberation that night on wording. I mean, that's typically not how we handle our regular city council meetings.
Would it make more sense to have, on that date, to have a resolution conversation that is scheduled earlier, that is specific to that, versus trying to hash it out during our regular council meeting? That's going to probably make that meeting go pretty darn long.
That's a public hearing night for your budget as well.
Right.
You could certainly meet prior to the 6th or earlier in the day on the 6th and work out some of the fine details.
Could you, when you get the draft, is it legal for you to send it to each of us so that we can each individually read it and know before we get here what it says?
You can read it, but if you're giving me input and
No, that would be at the meeting.
Right, so you would have it prior to the meeting, sure, no problem.
Okay, that way we can make notes, because, that way we can all read it and make notes as to what we would not be comfortable with or be comfortable with, so that'll cut down on some of the time once we're here.
We'll get the wording of that beforehand anyway, but the 6th, we could have a meeting on the 6th earlier, and the
2 o'clock.
was specific to the resolution, and 2 o'clock.
It might not be early enough.
Is that?
I think 2 o'clock is good, because then we've got a time limit.
I say we show up for breakfast.
Civility of the
I think some time constraints might behoove this.
Yes, that's what I'm thinking.
So we can just have a meeting at 2 o'clock, about the resolution. You'll have plenty of time to be able to look at it and see what it says and have some concerns. We can definitely, if we can't make a decision, which we've proven a number of times, if we can't make a decision within 3 hours, then we're going to be in trouble with the resolution
rewrite
anyway.
that resolution in our meeting.
That's right.
So what will happen is we will publish the agenda usually the Friday or the Monday before the council meeting. That will have a draft version of the resolution, which you will all be able to receive at the same time the public does. And then we can make that agenda item, make it clear that that is a draft version, and we can finalize that during that 2 o'clock meeting the day of the council meeting.
And then does that give you time to get that wording on for the meeting at 5?
Sure, as long as we're not done at 4:59.
And then